Okay, hear me,
Without me having communication problems.
yeah, I hear you okay. Can you hear me okay?
Yep.
All right. We're missing Tim and Heather. Tim, are you on? I haven't seen him sign on yet. Or Heather. John Tanner, I saw you out running tonight.
Was I actually running at the time? I had to do it instead of walking tonight.
Look, at the pace I go, I'm gonna call that running.
Okay. It was not my best work.
Hi, Heather.
Hi, everybody.
Can you hear me okay? Good, we're good. Chloe's on, I see.
Chloe's on, just unmute.
Chloe's on,
Hello.
yeah.
It's kind of dark.
Hi,
in
Chloe.
here.
Hi, Chloe.
Hello.
And Tim's on. Can you hear me okay?
Ken, got it. Thanks, Steve.
Great, I hear everybody. So at 6:30, I'm going to call the meeting of the Oregon School District Board of Education to order. Today is Monday, October 12th, 2020. It's 6:30. We're meeting via Google Hangouts and conference call. Roll call, please.
Ms. Garrison,
Yeah, sorry, I had to unmute. I'm here. Thank you.
Mr. Maring,
Here.
Ms. Flanagan,
Here.
Mr. Pankratz,
Here.
Ms. Bijak,
Here.
Mr. LeBrun,
Here.
Mr. Zach.
Present, board has a quorum. I have seen proof that the meeting has been appropriately noticed under Wisconsin open meetings law. And if anyone wants to see a copy of that, it's at with Katie Heights, so they can call and ask for that. The agenda tonight consists of our usual agenda items and then 4 informational items: opening of school updates, summer school report, report on professional development pathways, superintendent reports, then a potential closed session. I think we might move on time. I'm going to be short on time on that, but I'll talk about that as we move forward. But I would need a motion to approve the agenda as posted.
This is Anna Bijak. I will make that motion.
Is there a second?
This is Heather. I'll second it.
Okay, we have a motion and a second to approve the items on the consent calendar. I note we have a number of donations. One is from Children's Hospital for Healthy School Grant in the amount of $500 for OMS. Another one from Wisconsin Masonic Foundation in the amount of $1,000 for the ACT Kind Scholarship Match. The Oregon Masonic Lodge, $500 for scholarship. Children's Hospital for Healthy School Grant of $500, another $500 for Netherwood Knoll. Oregon PTO, $10,500 for Netherwood Knoll for the 2020-21 school year. And Friends of Oregon School District in the amount of $25,000 for Connecting Oregon Kids. On behalf of the Oregon School District, we thank you for those generous donations to make us a better place. Some significant donations there. With that, call the roll, please. The motion is to approve the items on the consent calendar.
Mr. Zach, do we need to approve the agenda first?
Did I miss that? Yeah,
This is Tim. I move to approve the agenda.
I think we have a motion and a second on that, don't we, Katie, or not? to approve the agenda?
I'll
I missed
second.
that, I apologize.
Okay.
Did we already do that motion yet? I know
We
we
did the
got,
motion.
No,
I
no,
on
Steve.
the-
We did not, Steve.
okay, so I've got a motion and a second, I think, on that, right, or not?
Yes.
You have a motion
Yeah,
and a
Katie?
second on the consent, correct?
How about on the move to approve the agenda?
Tim just moved and I'll second. It's Krista.
Thank
Okay,
you.
there we go. Sorry about that, everyone.
It's
Call
okay.
the roll on that.
Mr. LeBrun,
Yes.
Ms. Flanagan,
Yes.
Ms. Garrison,
Yes.
Mr. Meering,
Yes.
Mr. Pankratz,
Yes.
Ms. Bijak,
Yes.
Mr. Zach.
Yes, we have an agenda approved. Now we'll go to the consent calendar motion, which is, got a motion and a second on the table to approve those items and the donations I had identified. Call the roll on that, Katie.
Ms. Bijak,
Yes.
Ms. Garrison,
Yes.
Mr. Meering,
Yes.
Ms. Flanagan,
Yes.
Mr. Pankratz,
Yes.
Mr. LeBrun,
Yes.
Mr. Zach.
Yes, those items are carried by a unanimous vote. That takes us to item B, informational items. A couple things on that. First of all, just so people know, we've gotten a lot of emails in the last several weeks, and longstanding board protocol and one reaffirmed during this year's orientation session that we have to work on the upcoming year with our new board members is that we try to answer those with one voice so that we don't get everybody answering them and we lose them in the shuffle. So our protocol is when we get a generalized informational or question email is to forward it to the president or make sure the president has it, then it gets forwarded to the superintendent for a response. And so that's what we've been trying to do through the process in the last several weeks when we've got a lot of emails. And we've tried to catch them all, and I think Dr. Bergstrom's tried to catch them all. If we've missed them, we apologize. It's just there's been a heavy volume and a lot of stuff going on. So thanks for being patient with us, but I hope you understand that's been our board protocol. In terms of information items, tonight we have received a lot of emails in the public comment section of the agenda. We've changed up our public comment section just because we're working remotely and have accepted communications from the public in written form. We're guided under this and directed by Section 180 of our board policies, which gives residents the right to address the board, and that the board shall schedule 15 minutes at the beginning of each board meeting for members of the public to speak. And this time may be expanded for up to 1 hour at the discretion of the president. So I'm exercising my discretion tonight under 180 to extend the time period for public comment because we've got a significant amount of emails. We think we can get through them. Chris and I looked at them. We've tried to identify all those that have asked to be read tonight. And so we're going to plow through those and do those hopefully within the 1 hour. If we hit the 1 hour, we have to stop by our policy. But the agenda that has been posted said that if folks send written comments to us, we'll share those comments with board members, okay? And the public. So I think we're going to get through all of them. In case we don't, at the expiration of our policy time limit, what we'll do is all the board members will have those emails in written form to review. Our administration will have those, and we'll also post those on our public site for where you can pick up our packet members. Some of those may contain information that would be confidential under federal privacy laws for students. So if that happens, I'm going to work with Katie to identify those, to communicate with those folks to make sure they're comfortable having that posted as a public comment. So that's how we're going to proceed with public comment tonight. That may take us longer than 15 minutes tonight. In fact, it will. And because of that, the back end with the closed session for talking about the framework for evaluation of the superintendent. We may have to bump yet again. We think we can have time on Wednesday when we have a expulsion hearing to fit that in at that point in time, because we just really need to get that going. But I'm sensitive to everyone's time limits in these meetings, especially when we're going late at night. And I don't want to talk about evaluation as we hit a real late night hour. So that's how we're going to proceed. And that's pursuant to 180.05. I've checked with Laura Stoller for the OEA on the OEA report. And Laura, there's nothing from the OEA, is that correct? Yeah, she indicated that
Sorry, I
earlier,
was-
so there was nothing from the OEA. Yep, nothing from you guys
That
tonight.
is correct. Sorry.
Okay, thank you. And then we have student report, we have Andrew and Chloe on, and I said I'd move them up early in the agenda, just sensitive to their time as well to give a student report. So Andrew and Chloe, the floor is yours.
All right. Well, the Student Council has been busy working on some new ideas for a virtual homecoming week, maybe having some class competitions. So we're really excited to get working on that. We also are organizing a new student lunch, virtual lunch next week. So new students to the Oregon School District will be able to meet with people in their own grades and just kind of connect and meet some new faces. So excited for that. And Andrew's going to talk about a few other things going on in OHS.
Okay,
Yes.
Andrew, go ahead.
So
Thanks.
as to my knowledge, there are other clubs that have also started to meet now. I'm in the talks with Mal UN to try and get that started. I know the Multicultural Student Union is having meetings, and I know that Drama Club is active and they're trying to put on a virtual musical, however that may look. So students are really starting to adapt and try to make the most out of it, which is really what we want. We also do still want to focus on the education, but I think students now realize that they're in it. This is the school year, whether they like it or not, and they're trying to adapt the best they can. So I think it's been an improvement for a lot of them, and I think a lot of them are looking forward to see how it will improve and how their overall high school experience will change as we're online.
Great. Anything more, Andrew? Okay.
Not that I can think of. No, I think that should be good enough for this week.
Thanks, you guys. And you can hang out with us, or if you guys are crammed with homework, you can kind of multitask however you want, okay? Okay. Great, thanks. All right, so that's going to take us into the communications from public and the emails. And we'll begin at 6:41. And Krista's our clerk, so she's assisted me with this in terms of identifying emails that we received that were requested to have been read this evening, and putting them in order, and we're going to split those up. So I got the first batch, right, Krista?
You do.
So I get to go. We received an email from Andrea Bilo, who has said, "Dear members of the school board and Dr. Bergstrom, in light of the continued push by some parents who feel that this current situation is unfair and children need choice, I would like to again offer support from our family. The situation is hard for everyone, but the numbers speak for themselves. With positive cases popping up in our district, even with extremely limited in-person school, makes it unthinkable to imagine what would happen on a larger scale if the school opened to a larger in-person format. The photos of teachers and student families participating in non-social distancing events that came through social media feeds are enough to make it clear that keeping students safe in classrooms is an illusion. It would be great if efforts could be focused on families in need with lack of access to resources, mental health support for struggling students and staff, and ongoing improvement of the online classroom. Please continue to follow the science. There is no room for emotion and privilege in the discussion about health and safety. Best regards, Andrea and Derek Bilo." We received an email from Molly and Tony Vidal. "Dear Dr. Bergstrom and school board members, this weekend new yard signs began popping up throughout our community, yard signs that called for OSD to bring kids back. Needless to say, it was confusing considering Wisconsin is now nationally recognized as a COVID-19 hotspot. but just in case you are actually considering this demand by a small but loud group in Oregon, we wanted to write today and urge you to continue to follow the signs. We have 2 elementary age children who go to Netherwood and are part of the phased-in program. Recently, both our children began going face-to-face a few hours, Monday, Tuesday, Thursday, and Friday, and has been a constant source of anxiety as we watch the COVID numbers within our district and our state rise. Yes, it has been nice to have our children able to interact with their peers and have meaningful choice with their teachers, but not a day goes by that we do not second guess our choice to do phased in, because it is a choice that knowingly puts our children and teachers at risk. We know we are not alone in saying that a few hours of normalcy for our kids is not worth the risk to people's lives. Finally, there is certainly also an argument to be made that virtual school is a burden on already strapped families, particularly in situations where both guardians work or there is a single parent. There's no doubt this is a fact and one that we continue to struggle with in our own home, but it's not the responsibility of a school district to be childcare. However, it is the district's responsibility to provide quality education and to keep children and staff safe while in your care. The OSD is delivering on both of those responsibilities, even in the face of an unprecedented pandemic. The science is showing us that children can get sick. The science is showing us that we do not yet know the long-term effects of this virus. And the science continues to show us that the virus is willing to take the lives of people of all ages, races, and backgrounds. Please continue to listen to real science, not the skewed data of a loud minority, and continue to put the health and safety of our children and OSD teachers and staff first. Thanks for all you have done and continue to do for our community. I have one from Andrea I. Martin Fee, MD. Dear Dr. Bergstrom and members of the school board, first, I'd like to thank you for all the thought, time, and effort you have put into keeping our children, teachers, and community safe over the past 7 months. Though usually we have the luxury of focusing on how to continue to improve on education and support in our district in the absence of an obvious direct threat to us all, you are aptly recognized that basic safety truly must come first when we are in the midst of a global pandemic. As a parent and as a physician, I appreciate that. Now more than ever, we must continue to listen to the experts in guiding us about what is safest for our communities and our schools. With local case counts rising, local hospitals preparing for a surge, and even a field hospital erected less than 2 hours from us because of anticipated continued increase in prevalence, it chagrins me that a small but vocal group of parents feel otherwise. In Oregon, we are fortunate to have John Temte, MD, PhD, a nationally revered expert in viral transmission, advising us. His data enforces that schools pose a very high risk for viral transmission. I was thrilled when I learned he was one of our OSD's advisors, as I trust his advice implicitly. He lives in and cares about our community. My own observations revealed that children will be less than perfect in math scoring performance in a school setting. I will be thrilled when we can bring back our kids, but now is not the time. There is simply too much at stake. Respectfully, Andrea I. Martin by MD. An email from Dana and Jeff Hubernaus, and I apologize if I'm not getting names right. Hi team, I just wanted to write in support of the tough choices the OSD has had to make. I applaud you for doing the hard thing, even though it's not always the most popular choice. My husband and I are both nurses working in the thick of COVID-19 patients. We see what damage this is, the potential to inflict. While we understand it's likely that the vast majority of people will do well and recover, those that do get sick often suffer from irreparable damage and/or death. We appreciate the care given to OSD staff and students when choosing safety first. School time is replaceable, health and humans are not. Time and again, we have heard that we do not have enough teaching staff to support in-person instruction and virtual instruction. It is obvious that if we offered the choice for kids to return to the classroom on a grander scale, we would sacrifice the instruction for the kids who are still virtual. That doesn't seem like an equitable trade. We are a community that has a lot of privilege in many different ways. May we always use it towards equitable solutions instead of tactics that hurt others. We have all been given a choice for school this year. Some have made the choice to receive online. Some have made the choice for phased restart. Some have made the choice to homeschool their kids, and some have made the choice to leave the district. We have all been offered several choices and choose the best for our kids given this unprecedented situation. Thank you all for offering the best choices that you could. As I asked my oldest, who is starting his senior year at home in his bedroom, if he is angry that this will be what his senior year looks like, he offered these words of wisdom: Mom, as long as we're all safe, I can do school anywhere. An email from Jennifer Ben-Rafa. Dear Dr. Bergstrom and Oregon School Board members, I'm writing you today to address the topic of returning to school. I'd like to thank all of you for continuing to consult the Public Health Department and following their guidance. You are absolutely doing what is right for our kids and our entire community. As a CNA at UW Hospital, nursing student, and a parent of 3 kids, I've seen this pandemic from a few angles. I want nothing more than to see my kids back to school and activities like they were before. I truly believe they learned the best in school. I'm also fully aware that returning to normal is just not possible right now. Those of us working in hospitals watched the numbers and waited for the surge this past spring. Most of us were full of anxiety about the unknown and the worst case scenario. Thankfully, our community pulled together, stayed home, and prevented the worst case scenario. Today, we are again in the same boat, but this time we know it's coming, and all we can do is brace ourselves for what's to come and hope that more people follow the advice of the experts and try to limit the spread. We watch as towns and cities all over Wisconsin throw caution to the wind and return to school, work, and bars as if the pandemic's over. The results have been devastating all over our state. I ask that you continue to follow the guidance of the Public Health Department and do not expand any in-person schooling at this time. I truly look forward to when we can safely bring back our kids, but we just haven't reached that point that we can do so safely. Thanks again, Jennifer Ben-Rafa. Dear School Board, my name is Jackson Umhofer. I'm in 8th grade at Oregon Middle School. Here are some reasons why I think we should be back in school. I've noticed through the first couple of weeks of online school that it is nowhere close to what it usually is. I feel that in most classes, I am not getting the education to prepare me for high school next year. There are some classes that are not possible to do successfully in an online environment, such as tech ed. In tech ed, we are supposed to be building things and getting more hands-on activities. However, online, we are just getting worksheets. This is super disappointing to me, as that would have been my favorite class. But because we are online, I don't have a favorite class. Another thing I have noticed and experienced is getting kicked out of Google Meets. I've gotten kicked out of a class 6 times in one period. Now, because kids get kicked out of meetings, we are missing class. But when we are in school, it is impossible to miss class 6 times in one period. When I go onto my Google Meet every day, I see faces of depression from my classmates, no smiles. Most kids are half in and half out. No one is really getting things out of these classes. Most kids are doing their own thing, like staring off into space. Kids are also stuck sitting in their rooms all day and every day. I log onto every class and see the same thing every time. Kids who seem like they don't want to be there. If we were in school, the kids in classes would never stop smiling or laughing. Most of the time, the teacher has to tell the class multiple times to stop talking. I miss this. With online school being a thing in Oregon, kids who are younger are nowhere close to getting their learning in either. I have a little brother who's starting 1st grade this year. He gets the minimal learning. He now has started to go back 2.5 hours in the morning. While if we were going full on back to school, he should be going to school for 7.5 hours every day. There's a super big gap between those 2 times every day. My little brother has Down syndrome and doesn't get enough learning each day to be a successful 1st grader at Prairie View. I watched him struggle way too much in the spring and now this fall. He deserves to be in school as well. As an 8th grade class, we were struggling. A very disappointed 8th grader, Jackson Umhofer. Dr. Leslie Bergstrom and School Board from Adrian Ellert. I am Adrian Ellert, parent of Ashlyn Ellert in 7th grade and Anthony Ellert in 10th grade. I'm writing you as a parent frustrated and disheartened by virtual schooling. If you had to rate how my kids are doing in virtual classes, they are getting by. They're getting up every morning, logging on to classes and turning in their assignments on time. But bit by bit, they are falling behind. Neither there nor I expected virtual learning to be so emotionally draining, nor did we expect the schedule to be quite so demanding. Yes, we are privileged. We have been able to purchase adequate internet access and computers, and my children have guidance and attention as they attempt to learn virtually. However, this is not good enough. We cannot normalize this. Virtual learning is not sustainable. My kids are missing their social interactions in real school more and more. Day by day, they are failing. You may not see it in their grades this quarter, but you will definitely see it by year end. Maybe you have already seen the spark fade from their eyes as they begin yet another online lesson. As a parent, I'm very worried about the mental health consequences of indefinite virtual schooling. I'm worried about bad habits and substance abuse starting to creep into my teenagers' lives as a means of coping with isolation. And I'm worried about families that are not as fortunate as our own. Recent journal articles emphasize this point, and she cites a summary from the Minnesota Center for Infectious Disease and one from the Pediatrics Journal of American Academy Pediatrics, and then quotes from that. And I'm not going to read those lengthy quotes in the interest of time, but they will be located for board members on your packets and for people who want to get them. As a certified physician assistant, I'm well aware of the current high hospitalization rate for COVID-19 patients in Dane County. And I am aware that many parents may not feel comfortable sending their kids to in-person classroom in the near future. However, we must keep in mind that the number of positive COVID-19 tests in Dane County has been declining since its peak in mid-September. If this wave of disease follows past trends, the hospitalizations will plateau in the next few weeks. If we all continue to wear masks, socially distance, and wash our hands, we can hopefully see cases in the county decline further. Local school districts are considering and are having started hybrid education, recognizing that virtual education is not working well for many families and that most vulnerable children are suffering the most negative effects. Many schools throughout the state and country have successfully reopened without disastrous consequences. A safe and effective vaccine may not be widely available for years. COVID-19 will likely continue to surface in Dane County for the foreseeable future. Meanwhile, our children will continue to grow and develop with or without public schools. I deeply empathize with the challenge that the pandemic places on public school. We have faced similar challenges at the hospital where I work. Workflows are new and in constant flux. PPE is in short supply. Nationally, we face a lack of leadership and funding for appropriate testing and contact tracing. All Americans have seen the world's upended by the pandemic. Yet for the sake of our children, we must persist. We continue to strive for excellence. We must continue to strive for excellence. We must continue to look beyond the bounds of what we think is possible and seek solutions for the families of the district. I'm asking the board to then vote on solid, measurable, and definite plans. I'm asking the board to look critically at public health data and think critically about the current metrics and what they mean for long-term well-being of our children. I'm asking the board to look at the data from similar school districts to inform decisions, and I'm asking the board to create a plan that gives parents some choices moving forward regarding virtual versus hybrid versus in-classroom education across all levels. After 4+ weeks of virtual learning, the parents and students should be surveyed again to see how attitudes are changing. There is a lot of Panther pride in this community, but virtual learning has tested the resilience of many families. Please don't give up on my kids. They haven't given up on this school. With respect, Adrian Ellert. An email from Karen Davidson. Hello all, I'm writing to express my support and appreciation for how OSD has chosen to implement schooling this year with a safety first science-based approach, especially with the way COVID numbers are across the state. It makes no sense at this time to implement a hybrid model for all students, which will increase the level of exposure for students and teachers, as well as for the families of students and teachers. I'm aware of how hard this school year is on people. My own 5th grader is really struggling with online schooling. In spite of that, I'm grateful that OSD is prioritizing keeping kids and their families safe from this virus. This pandemic is hard on everyone, some more and some less, but I do not believe offering a hybrid schooling option is the fix for this. working towards equity for all, access to schooling, Wi-Fi, enough food, school materials, and keeping kids safe, and basing decisions on best scientific practice should remain the primary goals. You have my permission to read this letter. Karen Davidson. Coral Goplin. Dear Dr. Bergstrom and OSD or Oregon School Board members, I would love for my email to be read into the record at the OSD board meeting on April 12th. I appreciate it, and I recognize you will have a lot of reading allowed to do, and I'm sorry to be adding to it. First, thank you. What a time to serve our community in this critical position. I'm so thankful for the ways that you are sacrificing for all of us. As a parent in the Oregon School District, mother of 2 boys enrolled in Oregon Online, and hopeful as many of us are that we will be able to return to in-person instruction someday, I want to state that I support the decisions and caution our school district is exercising about returning to school in person. My family lives in town, and any community spread that occurs will impact us, our neighbors, and our remaining normalcy. I recognize and acknowledge the many ways, social, emotional, as well as academic, that this pandemic and online learning has impacted our students. As an adult, the move to managing my workload and direct reports remotely has been difficult and in many ways awful. I know that if I, with 30 plus years of humaning, I'm struggling, I can't imagine the impact on the tiny humans in our community. And when I think about that impact, I do not question the decision of the school board to continue to follow the DHS guidelines and recommendations. Instead, I wonder how I and my small family can help support those in our community who are struggling more than we are. Please know how grateful I and my family are for all the hard work you do. From Stephanie Osborne. Leslie Bergstrom and Oregon School Board members. On September 27th, I wrote a letter explaining the impact continuing virtual learning is having on my children and our families, the desire to have an in-person instructional option provided within our district. Although I did not request a response, I was disappointed to receive only one response from Dr. Bergstrom. Not a single board member responded acknowledging my concerns. In this letter, I will be more direct. I would like the school board to read this letter at the school board meeting and address the following concerns. At the previous school board meeting, it was discussed that there would be a survey evaluating how our district's current plan is working for families. 2 weeks later, survey has still not been sent. When should we expect to see this survey? 2, one argument against in-person education is the safety of our teachers and communities and fear of COVID transmission within the school setting. Research is finding that schools are not the hotbed of transmission that they were feared to be. Please address the preferences of our teachers. Do they want to be back in the classroom, or do they want to continue teaching remote learning? I'd like to see our teachers surveyed in the creation of a solution that works for every party involved. School boards in our neighboring districts have all weighed in on the decision-making process for their districts regarding in-person versus remote instruction. I understand the structure of our board is different than other districts, but as publicly elected officials, where do you all stand on this topic? You all were elected to represent the community, including me, my children, and our desire to have in-person education option. I would like our board members to express their stance on the topic as well as their supporting arguments. I'm aware of several families that are moving their children out of Oregon School District homeschooling, attending private schools, or open enrollment in other districts who are providing in-person instruction. Please address the number of students OSD has lost and the financial ramifications of these losses. What experts are providing guidance to the OSB and Dr. Bergstrom? We have many exceptional community members in Oregon in a variety of career fields relevant to child development, health and wellness, and learning during this pandemic. Are these experts being consulted? Are we ensuring our consulted experts aren't politically biased? Are we looking at all the consequences of continued remote instruction? A few to note: socio-emotional development, vision, physical health, mental health. Please compare the negative effects on our youth and the likelihood of occurrence of COVID versus the negative side effects of continued remote instruction. Are we as a district meeting our direct pupil instruction hours requirement as set forth by the state of Wisconsin? I look forward to hearing the school board's response on these issues. Sincerely, Stephanie Osborne, mother of 4 OSD students. Dr. Bergstrom and board members, Beth Melcook. I'm writing to you today as a concerned parent of 2 OSD students, a community member, and a former social worker in Child Protective Services. One of my biggest concerns, in addition to the educational and achievement gap that continues to get wider due to our only virtual learning option, is the emotional, social, and safety risks that are being disregarded when we view our children only as disease-carrying statistics. It's time to take a holistic look at what they need. As a previous social worker in Child Protective Services in Dane County for 7 years and having a master's degree in social work, I will tell you that we are doing our at-risk students a greater disservice of not having the safety net of school support, eyes on them, mandated reporters to protect them and services than the risk of them contracted the COVID-19 virus, let alone dying from the virus. There is a plethora of research and professional medical statements regarding the risk we are putting our children at by not allowing them the opportunity to return to in-person learning. As indicated in previous emails to the board, the CDC, American Association of Pediatrics, and the American Academy of Child and Adolescent Psychiatry have recognized that education and social opportunities are an essential component of successful and healthy development for all children and adolescents. While we cannot eliminate all risk when it comes to COVID, we can mitigate the risks that accompany social isolation. In the past weeks, you have received at least a dozen case studies of school districts in Wisconsin across the nation who are providing in-person learning options that are working for their students. In these cases, we have included comprehensive reopening plans, district COVID metrics dashboards, media reports, and resources on these schools. While I understand the challenge this presents for our district, it is clear that hard is not impossible, as many other districts, while faced with similar, if not worse, COVID cases or deaths, are making it work. In fact, many of their students are also engaging in athletics, social clubs, and they are doing it safely. Do you have any idea how painful it is for your children to see their friends 1 county away or across the U.S. to be playing the sport they also love or attending homecoming events while they are told it isn't safe for them? It doesn't make sense to them because honestly, it doesn't make sense. What are other school districts in Wisconsin nation seeing, hearing, and evaluating when it comes to risks that Dane County schools aren't seeing or understanding? This virus and its risks are not limited by county lines. In fact, the rates of COVID deaths, especially the ratio of deaths per positive case counts, are exceedingly higher outside of Dane County. For example, in Milwaukee County, the fatality rate is 1.7%. Aside from Milwaukee public schools in Milwaukee County, such as Brown Deer, Cudahy, Bayside, Franklin, Green Bay, Wauwatosa, Whitefish, and Whitnall are open and successfully operating on a hybrid model, whereas Dane County, the fatality rate is 0.4%, yet somehow our children are more at risk going to school. We will never eliminate risk associated with this virus, just as I cannot eliminate my risk or my children's risk when they drive a car, plane, or play a sport, fly in a plane, or even exercise. I am confused about who we are trying to protect with this decision if the evidence exists that there are 0 cases of deaths in children in the state from COVID, and as of September 30th, 113 children in the entire United States in a population of 73 million people are under the age of 18 have died. That means 0.00015% fatality rate for children 0 through 18 in the US. According to the CDC, in April 2019, there were 186 pediatric deaths from that flu season. According to IDSA, during the 2009 H1N1 influenza pandemic, there were 317 American children who died. Why didn't we shut our schools down then? The latest data on DHS's website contradicts the messages we are hearing in the media about the enhanced danger COVID poses to Dane County. As of September 22, 2020, the 3-month mortality rate in all Dane County was 0.1%. Large increases in positive case counts are not leading to increased deaths. In addition, according to the dashboard, there's been 1 death in the county under the age of 40 and a total of 3 deaths under the age of 60. If we are concerned about the risk to teachers, Dane County metrics show us that risk to teachers who want to teach in person is small with safety measures in place. Every one of the 44 lives lost to COVID in Dane County is a tragedy. However, we are putting our students and frankly their families in positions of other risks and failure by operating out of fear. We are imploring OSD to provide choices between virtual or hybrid learning for our town and families based on local data, not Dane County metrics that are virtually impossible to meet. When making decisions for our town, it's important to recognize that Oregon only represents 2% of the total Dane County population and only has 1.4% of the COVID cases. Shifting from the risks that our kids pose to the community, let's examine the risk we are putting them at with social isolation. We are subjecting them to. According to the CDC's website, in 2017, suicide was the second leading cause of death for persons ages 10 to 19. The death rates due to suicide for ages 10 to 24 was 0.012%. That means at-risk kids, the ones who need to be in school the most, have a 4 times higher likelihood, according to this data, to be at risk for death due to suicide versus COVID. In this department, Dane County has epically failed to protect our children. The adage hindsight is 2020 might work when it comes to business decisions and tax spending, but that doesn't work well when talking about children's lives. We claim that we are concerned about our students spreading COVID to teachers and into the community at large. However, daycares are and have been open countywide, and our teams are part of the essential workers group who are stocking shelves, waiting tables, and checking people out at the grocery stores. There is a contradiction in our own school district when arguing against the safety of in-school learning when the Oregon After School Club is currently operating from 7 to 5 inside Netherwood Knoll in 3 groups of 15 children, ages K-1-2 for parents who can afford this supervision, care for their children, not to mention the day camps offered by recreational centers and trampoline parks in Dane County. Of course, this is unaffordable for most families, only furthering the gap. As we know, you have a difficult job of protecting the students and teachers. I have had a chance to review the survey of parents and school district employees, including teachers, right before school started. Aware that a majority of parents wanted to have the option to send their kids back to school. My request is that you send out another survey within the next week, now that we know a lot more about this virus, and now that families and children have been able to experience the impact of virtual learning. I've spoken with several families who would like to change their responses now that they have seen how difficult this is for their children and the strain it's putting on their families. It is also my understanding that teachers are working overtime and feeling like they are making less of an impact. Maybe they would like to revisit things too. In the survey, please specifically ask parents for their updated preference: virtual only learning, a choice for a hybrid model, or in-person only learning. Please ask for an assessment of their child's mental, social, and emotional well-being. Please inquire about the choices they are exploring for their children, if education for their child, if a hybrid or in-person learning option is not possible for the 2021 school years. Please also provide a section that allows for open comment feedback on these and other concerns. Closing, I'd like to request that the school board members who are elected to represent the families in the district vote on a hybrid model for grades 3-12, whereas there is an in-person learning educational plan to be implemented as soon as possible, or at the latest the second semester. I would like to request that the school board member allow for, with input from the community, the formation of a medical task force subcommittee to compose of medical, mental health, social work, education, and experts in organizational planning and implementation. There are highly qualified professionals in our community who would like to serve as advisors on a task force for the district. Their expertise and insight would be invaluable for your decision-making process and work towards opening our schools. I come to you as a concerned parent who represents the concerns and voices. Many parents in the district, some are afraid to speak up. That makes me sad, because while I am challenging decisions being made for our children, I want to better understand why they're being made so that we can all support each other, our teachers and our children, in finding a solution that serves all the children in the district, no matter how difficult that might be. As a parent, I have fully trusted the district to have my children's best interest at heart. I've never felt the need to look at how the school district is doing compared to other school districts in the area, let alone the country. I believe that we've always been one of the best. I always believe that we prioritize our kids' education and all aspects of the health. I, like all other parents, would like to continue. Sincerely, Beth Belcock. And one more from Julie Myers. Dear board members and Dr. Bergstrom, let me first congratulate you for handling this global pandemic with integrity, compassion, and based on scientific results. I'm very grateful to live in a district where I know the health and safety of my child and that of our teachers and community comes first. I'm very impressed with how this semester has started and the resources provided for our children to have the best experience working at home and as they possibly can have. The teachers are amazing in handling this new and challenging situation. I was shocked to find some signs in the neighborhood indicating that some parents feel that bringing their kids back to school is a good solution. I can't believe there is a group of parents who prefer risking the teachers, staff, and ultimately their own families' health by sending children back to school. I encourage you and support you in your decision to keep our children and teachers home for the most part, and I'm impressed by the measures that were taken to address those families in need due to lack of access to resources, mental health support for struggling students and staff. I have several close friends who are teachers in the school districts not as conscious and accommodating as ours, and they are close to burnout due to trying to accommodate in-person and hybrid classes at the same time, in addition to being constantly worried about their health and that of their families and students. Thank you for your professional way of handling the situation. Sincerely, Julia I. Myers, PhD. Krista, your turn.
I just want
Thank
to
you.
make a note too that the order in which we're reading these letters are the order in which they came in, so they're time stamped, and so we did not put them in any order. We're reading them as they came in. Dear School Board, I am writing to advocate for my children and other students who need in-person learning. Since communication between the board and the community has been severed, emails are our only option. We have not been given a question and answer period, so I feel like our questions are not being answered. Not everyone feels comfortable speaking up, but there is a large group in Oregon who are fighting for our kids' education. For those that need or want virtual learning, that should always be available, but I strongly believe that we should have the right to choose what's best for our family. Somehow, through this virus, Dane County has deemed education as non-essential. If you look across our beautiful state into our neighboring counties and even private schools within our county, school is in session, in person and in a safe way. Masks and social distancing are required, visitors are kept to a minimum, and cohort learning is making contact tracing easy and efficient. Adding a day to our school year in June because of an extra snow day used to be our concern. Now our children receive less than half of the usual instruction time. The fact that kids are allowed to gather at trampoline parks, gymnastics facilities, swimming pools, and movie theaters, but not at school is shameful. Families are leaving Oregon School District because they want a choice. You have heard many, many pleas over the last few months of parents begging for a choice to have in-person schooling. They brought up metrics, mental health, education, family stress, and technology. Time is of the essence. Our children's future is at stake, and parents' frustration is growing as we continue to wait for the school board and the superintendent to have in-depth discussion about how and when our students can return to our beautiful schools. Parents that need childcare are paying approximately $200 per week per child for centers such as Karate America. How many parents will continue to do this when they could pay the same amount for in-person private education at St. Maria Goretti's in neighborhood Fitchburg or St. Anne's just down the road in Stoughton? How many parents will choose to drive their children to free in-person schooling in Evansville, Edgerton, or New Glarus, all of which are just outside of Dane County? By not offering a choice, you are forcing families to leave the Oregon School District. How many students have open enrolled or opted for homeschool since July 30th when the district announced an all-virtual start to the school year? How many more need to leave the district before the board will take a vote on providing parents a choice? No one asked for this pandemic, but here it is. Community members, business owners, and school boards across the country have had to make tough decisions. The only people who can decide if our children go back to school are you, Dr. Bergstrom, Mr. LeBrun, Ms. Flanagan, Ms. Garrison, Mr. Pankratz, Mr. Mehring, Mrs. Bijak, and Mr. Zock. 8 people decide our children's future. What I'm asking for is neither irrational nor dangerous. There are larger schools providing in-person education in a safe way all around us. Parents want their kids back in school, and our students want to learn in school, and our teachers want to teach in school. What are we waiting for? I've watched other school board meetings in Dane County and their disagreements, civil discourse, discussion, and eventually a vote. Oregon school board meetings seem to be a few questions or thoughts from a few board members that our president, quote unquote, pulls rank and gives his opinion, which seems to shame anyone who disagrees. It's a disgrace that on a topic of this magnitude that our elected board has not voted. At your last board meeting, the topic of disenfranchising families was brought up. Right now, the district is disenfranchising the 66% of Oregon families that filled out the survey in July and asked for in-person instruction, as well as the 75% of Oregon families who enrolled their children in the hybrid in-person educational model. Again, those that opted for virtual only can continue virtually. Oregon families deserve a choice. I advocate for my children, and you're supposed to advocate for us. Please acknowledge, contemplate, and deliberate over what you're doing to the children and families of our community. I hear the plan is coming and will be shared with us. How quickly can it be implemented? When will the board vote? Sincerely, Nikki Holson. Ms. Bergstrom, I request that my letter be read out loud at the OSD board meeting. I have witnessed firsthand how devastating your decision to ignore the pleas of the parents and students in your district have been. While other school districts welcome parent involvement, medical opinions, and have a comprehensive plan to move forward, our school district remains unyielding from their own perspective and sometimes biased political view. You have been elected by your community to represent your constituents and, most importantly, to provide a nonpartisan, robust education for the children in your district. I raised my children in Oregon, and as adults, they and many of their friends returned to Oregon because of the highly valued school system. How disappointed many of them are now. A new survey should be sent out in the next week so that you can once again be in touch with how you are affecting parents and children with your choices. Where I once held teachers to the highest esteem and considered them essential workers, I now doubt myself. I have one daughter who works at a local hospital. She has worked with patients through this pandemic and puts herself and her family at risk for the benefit and health of the community. I have another daughter who is a teacher. Everyone is concerned with her health, her family's exposure, and her daycare concerns. Not so for the one who is in the medical field. I'm sure the same is true for other essential workers such as police, firemen and women, grocery store workers, truck drivers, etc. So the big question is, are teachers essential workers? The children coming to school are much less of a risk to the teachers than patients are to employees at the hospitals. And as for protecting the community, you are forcing grandparents out of the safety of their homes to help with grandchildren's online schedules, or even worse, the safety of young children whose parents have to make difficult choice of providing for their family or leaving their kids home alone. You need to move forward on getting these children back in school, not only to advance their education, but also for the social and health implications for them, their parents, and the community. Make the education of our children your priority. It's what you're elected to do. Sincerely, Kay Mills. I would like to thank the Oregon School Board or School District for putting the health and safety of our families and communities first during this pandemic. As a parent in the Oregon School District, I am very much looking forward to when we can return to in-person instruction, but with the rising cases in Wisconsin, it is clearly not a safe time for that to happen. I support the decisions and caution our school district caution our district is exercising about returning to school in person. Thank you, Jesse Joplin. Mr. Zock, I have attended the last two board meetings and have also had several email exchanges and informal conversations with Dr. Bergstrom and other board members in the past 3 weeks. I'm sure by now you are aware of my and the Bring Kids Back stance that our kids deserve a choice for in-person schooling. We are not advocating that all kids return to in-person. Parents that do not want to have their kids attend in person could still choose the virtual option. During board discussions regarding why you have not chosen to implement an in-person option for grades 3 to 12, I have heard you, Dr. Bergstrom, and others raise concerns about the safety of parents and extended family. While safety of our extended community is an issue, the responsibility for this falls on the adults in the community and not the school board. I would like to reference Board Education Policy 175, Student-Centered Decision-Making. This policy states, among other things, that the board believes all district decisions should have as their guiding principle its students and their learning. Knowing the importance of in-person learning, the inferior quality of virtual learning, and the scores of reports documenting behavioral and mental health issues associated with not being in person, how can you and the rest of the board honestly say you are following this guiding principle? In the meetings I have attended, this directive seems to get obscured and the focus shifts to PHMDC metrics or protecting the public. While these are important things, they lie outside the responsibility of this board. I respectfully ask that you, Dr. Bergstrom, and the rest of the school board take a minute to reread this policy and make your future decisions on our kids' education based on this guiding principle. That was Jim Schlein. Oregon School Board. I have been disappointed in the lack of focus on returning to a hybrid model now that we have the option to do so. During Dr. Bergstrom's parent listening session on July 16th, she drew our attention to Oregon School District's guiding principles with equity as the main focus. The 4 puzzle pieces that link our core principle of equity are health and safety, mental health and social emotional learning, the high quality education, and flexibility and adaptability. You have a large group of parents telling you we are falling short in addressing high quality education and mental health and social emotional learning. In spite of multiple emails, a parent rally outside the last school board meeting, and a family survey indicating 67% of families want a hybrid option, we still do not have a date for the beginning of 3-5 grade classes. Our teacher survey indicated 73% would come back in the fall for in-person schooling if it was available. In Dr. Bergstrom's presentation, she reports the planning for the fall semester of school began last spring as soon as they knew the 2019-2020 school year would not be resuming. I would like to see the results of that planning. Where is the hybrid learning document for our K-12 learners outlined, and when can we begin phasing in our 3rd through 5th grade students? We have one $6.5 million in our budget for COVID-related expenses that can be deployed for cleaning, extra staffing, and PPE. In the interest of transparency, we get updates on every school member that tests positive for COVID in our school district, even when it has nothing to do with school. Why then, in the interest of transparency, do we not have access to the hybrid model OSD has created for our kids over the last 6 months? Where is the document that will guide our 3rd through 12th grade back to school? Parents have sent this board and Dr. Bergstrom countless articles and studies outlining the minimal risk to kids from this virus. Dane County Public Health Madison provided metrics for us to follow outlining the acceptable disease burden in the county for kids to go back to school, and then they promptly ignored it. Why haven't we haven't had below 54 cases a day in Dane County sustained for 14 days in months. Yet they continue to tell us our K through 2nd grades can be in school. They insist we follow their capricious science and data while ignoring their own science and data. I point this out to illustrate that just because educated people tell you they know what is best doesn't mean they actually do. Public health departments in each county in this state have made decisions about what data plans to follow on their own. There isn't an ordained gold standard to follow. Oregon's school district could choose to take bits and pieces of each and create their own metrics that no one can rationally be expected to follow. At the end of the day, parents are the ones that should decide what is right for their own families. Our school district should provide parents with options and then allow them to decide for themselves what risks they are comfortable with. We can put many things on hold in our society today to allow for safer environments, but one thing that does not stop is the growth of our children. For every day they are left out of the classroom and expected to learn at home, they lose the education that comes from interacting with their peers, teachers, paraprofessionals, coaches, counselors, bus drivers, lunch attendants, and janitorial staff. Each and every one of these people impact how that child grows up and who they become. Making connections with the people in our community is a critical component to developing empathy and compassion for the people around us. We ignore that fact at our own peril. If we leave these kids sequestered, it is estimated that the educational achievement gap will increase by 15 to 20%, according to Harvard T.H. Chan School of Public Health. School districts outside Dane County have functioning plans in place and have been responsive to the changing needs of their communities. There are options. Our kids deserve an option as well. Speaking with the parents of young kids that are now back in the classroom, they report a marked improvement in their attitudes and outlook to school. They are happy again and enjoy learning again. We've spoken to parents that have enrolled their kids elsewhere and hear the same thing. Their kids aren't with their previous classmates and are the new kids, but they are happier at a new school than alone. No one denies the existence of this virus, but focusing only on this virus is too narrow a vision. According to Johns Hopkins COVID-19 dashboard, 99.6% of people that have tested positive for COVID-19 in Dane County have recovered. Refusing to provide a hybrid option and working toward getting our kids back in a classroom based on those numbers is irresponsible and irrational. As school board members, you have a duty to this community to ensure our school district provides for the educational needs of all your students, all of them, not just the ones that want or need to stay home, all of them. If this school board and this school district is truly dedicated to equity, it is time to put action behind those words. If you do not, the tax base that supports our schools and therefore the backbone of this community will crumble. I'm requesting the board go on record with a vote from each school board member for or against implementing a hybrid model for the 3rd through 5th grade. I'm requesting a new survey be conducted to better understand how parents are now wanting hybrid or in-person instruction versus virtual, so administration can begin coordinating and planning schedules for those that will be back in the classroom. I'm requesting the board begin in-person meetings again to allow for the participation of the public. The in-person meeting on September 28th in the high school cafeteria demonstrates it can be done safely while honoring social distancing and masking. Finally, in the event this board votes to commit getting all kids back 3rd through 12th grade in a hybrid model by the start of next semester, I pledge to quit my job and volunteer in the classroom daily to support the teachers and the students. I would much rather do this than get a second job in order to send my kids to private school. I trust and respect our teachers in this administration to bring our kids back safely. I know we can do this if we find the will to make it happen. We moved to Oregon and chose this district because of the community and its reputation. My kids want to stay here, and I'm begging you to not force us to choose Evansville School District or private school. I feel at this stage in my high school kids' lives, ensuring we're somewhere that can provide a high quality education to our kids is our single greatest responsibility as parents. I tallied up each of my kids' in-person minutes of education today and found they will be getting 198 hours of instruction this semester. In a typical school semester, they would be getting 568 hours. That is less than half. If this administration and the school board cannot find the will within themselves to bring the kids back, many of us have no choice but to leave. Thank you for your time, Aaliyah King. Mrs. Bergstrom, first I would like to say what a great job the teachers and staff at Netherwood Knoll are doing to try and make the virtual learning work for the children in the Oregon School District. In fact, they have been nothing less than amazing for the 3 years we have been in the school district, always making my children feel welcome and loved while nurturing their learning. While we were looking for a place to call home, school districts were an important factor in that decision. Unfortunately, things changed when COVID-19 came around and everyone had to change on a dime. As the 7 months have passed and we learned more about this virus, many of us expected to have some sort of in-person learning for our children, some sort of hybrid where students could have face-to-face interactions with teachers and other students. We also expected that there would be some families that would not be comfortable with in-person and an online-only learning would be put in place as well. From what I've heard, the online learning is working for those that decided on that option, but for our family, the hybrid with no in-person option for grades 3 and up is not. For our family, along with many other families, actually getting online has been a struggle because of the availability of internet where we live. Another issue is learners need to be able to interact with their teachers and let them know what they don't understand, what is being asked, or understand a concept. I don't think a third grader has the ability or even the confidence to tell her teacher that she doesn't understand what is going on. In person lets that teacher connect with each student, build a relationship to where our amazing teachers can ask the questions to make sure the student understands. I'm sure you know that there are many families, other families that are feeling that way, families that feel their children are struggling in so many ways, some that even parents don't fully understand yet. I do believe that there are ways to open schools at least part-time for those that would like to. I know that other districts' plans have been sent to the school board and those districts have decided to find ways to make in-person school work instead of finding ways that it would not work. I also think the Oregon School Board should allow and support a medical, mental health, social work, and education experts in making opening decisions. Ask our community members for help with coming up with opening plans. There are community members that are well-versed in safe opening plans. With no date set as to when my struggling third grader will be able to attend school in person, we made the decision over the weekend to enroll both of our children in a private school. I was heartbroken that I even had to make that decision. We are very fortunate that we were able to make that choice, and I know there are many that don't have that option. I ask you to start looking into more ways to get the families that would like in-person learning in school before more families make that same choice. Thank you, Jesse Purick. OSD board members. I am writing to show my support of the current model in which students are being taught at OSD. As I am sure you are getting several messages on this subject, I will keep this short and leave it up to your discretion on whether or not to read at the meeting tonight. There is a group trying to get the option to bring students back into schools, and I disagree with them. We have seen across the state schools open that have had to move to virtual options. The back and forth from in-person to online creates an unneeded strain on students and teachers. Before the school year started, it was clearly laid out that OSD was going to follow the guidelines set forth by Dane County Health, which is why we chose the option for the gradual restart. If OSD would then reverse their decision because of a group of loud parents, you would lose the trust and respect of many in this community. We are nowhere near meeting the metrics as laid out by PHMDC. Wisconsin is currently the hot spot in the nation. Daily cases are at an all-time high and hospitals are starting to get overwhelmed. We are seeing patients from other areas of the state being transferred to Madison hospitals due to lack of space, and we're opening field hospitals. I'm asking the board to stay the course they laid out for everyone at the beginning of the year. Lastly, I would like to express my deep appreciation and gratitude to the teachers and staff that have worked tirelessly to make this year the best it can be under the circumstances. Specifically, Alexis Johnson, second grade teacher at Netherwood Knoll. Her upbeat attitude has helped my daughter keep her excitement for school, whether it is in the classroom or virtually. Jolene Wyszynski, seventh grade German teacher. She has gone so far above and beyond to connect with students, explain how to navigate the virtual system, and taken time to truly connect individually with her students. And Cindy Olander, principal at RCI. While we currently do not have a student at RCI, she did not hesitate to jump in and help us get connected with the new people at OMS that could help us and continues to check in on how our family is doing. There are many, many more that I could list out, but I stated I would try to keep this email short. We truly do have a wonderful school district. Thank you, Melissa Kingsley, parent of second and seventh grader in the Oregon School District. Over my lifetime, America has been a country seen around the world as a place where the lives of its citizens come first. Facing reality, I personally feel different about it. The country has become more divided across lines to a point that should be concerning if you are an American. There is an invisible war raging through the country, and the soldiers tasked with fighting this war are saying to do these things and we will be fine. But we have those that are more interested in going back to pretending that exposing the lives of our kids and teachers means nothing to them. Most of our teachers will be happy to come back to see those kids they parent most of the time. Think of it, our kids spend more time with them than they do with us. We are here debating whether to bring them back to a confined space so that they can get infected. Most of these teachers have kids who they left at home just to fulfill a passion they have for our kids. Those kids are mostly not within our districts because they are not paid enough to afford a home within the places they work. If you are comfortable with exposing your second family, teachers and supporting staff just to be right, well, remember that you should be willing to welcome the guilt of any loss resulting from bringing the kids back. If the health care we have is uniform, that shouldn't be a problem, but most families have an insurance that will bankrupt them before the insurance company starts paying. If we as parent and a school district choose to provide a cheap and affordable health care for our teachers with the view of saving money, I think we are not in a position to decide whether to expose them to danger just to satisfy our greed. They are human and can be sick from the disease. Assuming this was a physical warfare, would any of you ask to bring your kids back to school ignoring the fact that there is a great chance that they might come home sick or injured? If your kid doesn't lose their lives from this, do you think they will be able to be happy or will be happy to be associated with bringing their friend into an unsafe situation? We all as Americans do better when united behind the right thing and when we decide that we are not comfortable with the loss of lives, be it that any American. Please take a step back and think of it from a different point of view. Material and financial things can be replaced, but lives can never be replaced. Whatever decision the board is going to make should be with the thoughts of people, children, teachers, supporting staff we are asking to risk their lives. Thanks, Edward Ogadogo. Dear Dr. Bergstrom and members of the Board of Education, as a longtime resident, parent of past OHS graduates, and a taxpayer, I'm reaching out to thank you for your wise and skillful approach to the education of students this school year while we continue to navigate our current pandemic. These are not easy times for anyone, and I empathize deeply with students, families, teachers, and administrative staff who are trying to make the best of a less than ideal situation. Offering the choice between semester-long virtual only and public health and safety informed hybrid options feels smart and compassionate for our entire community. The potentially grave consequences of further spreading COVID-19 are too important to overlook. Furthermore, it has been clearly communicated by your office that there are limitations in physical space and staff to be able to safely offer in-person classes on a larger scale at this point in time. Please do not feel pressured to expedite your careful thought-out plan. As an independent mindfulness educator and small business owner in Oregon struggling to stay afloat, I want nothing more than to return to normalcy. I fully understand the benefits and desires to teach and learn in person. However, I'm concerned about the overall impact opening schools too quickly will have on already increasing positive test results in our area. There's too much risk to the health of the vulnerable community members and the productivity or reopening of businesses like my own. As a professional wellness educator, I do understand the toll this pandemic is having on the social and emotional well-being of children, teens, and adults. As a community and school district, we absolutely need to be concerned about this. However, I do not believe rushing to reopen schools is the only answer to addressing this. I would prefer to see an increase in evidence-based initiatives in social and emotional learning for students, teachers, and families, regardless of risk factor, that will help develop lifelong resiliency skills as we continue to weather the challenges we face until a vaccine becomes available. There are skillful ways to mitigate the anxiety, frustration, disappointment, and loneliness that comes with uncertainty and unwanted change. The development of these skills can have a direct impact on learning and our ability to co-regulate and support one another, even in virtual settings. Lastly, I want to applaud all of the teachers, administrators, and support staff in our district. They have been going above and beyond to recreate their craft under very trying and exhausting circumstances. You are all appreciated. Sincerely, Kelly Petrie. How are we doing on time?
You have about 6
Like
minutes.
6 more minutes.
Okay, good. I think we can get through them. OSD administration and board members, I'm writing in lieu of personally attending tonight's board meeting. I'll appreciate everyone considering very seriously what I have to say. I would also like this to be read at the board meeting. I believe most everyone understood why schools were originally closed for the in-person learning at the outset of the pandemic. Since then, we have all learned and have a much better understanding of COVID-19 effects on different demographic groups as well as safety protocols. We also have significantly improved treatments. We now have scientific data as well as opinions from many, if not most, of the world's leading experts. I know that you have received much of this data from other concerned parents in OSD. Honestly, I'm having a hard time finding any medical experts that are advising school closures at this time. Even the World Health Organization is now telling us that damage caused by school closures is outweighing any potential risk from COVID. As we all now understand, the vast majority of children are at a very low risk of significant health issues with contracting of COVID. I have, however, personally witnessed with my 3 children the harm being caused by the decision to offer only part-time virtual class. The isolation, lack of routine, elimination of athletics, loss of socialization, and nearly complete lack of meaningful education is now causing real and measurable harm to our kids. I've witnessed my youngest withdraw from everyone and now have to fight with him just to get him out of bed in the morning. He is studying next to nothing and struggling with what he does have due to lack of teacher availability. He knows there's a bare minimum of education time and requirements each day, so he's just breezing through the short time of virtual learning. His eating habits have changed. He doesn't want to do anything physical, is not interested in anything. He is showing very obvious signs of depression. Missed, of course, by professionals at the school as they no longer have personal interaction. Sad for a 10-year-old who should be full of energy and vigor. We are doing our best to get him to watch history videos read books, and learn through other methods, but is not adequate outside the normal routine testing that teachers are best equipped for. We as parents are not trained as teachers are and cannot replace what they offer in person learning. Our older kids also breeze through the little bit of work they receive and are learning next to nothing. They miss sports, friends, and being able to ask a teacher for help without playing online tag. They have issues with internet connectivity due to our rural location. They have no structure in their lives anymore. Sometimes class starts late mornings or afternoon, not a good precedent to set for high school, where they will soon need to be up and about in the mornings for either work or college. I am extremely concerned about their future once they are done with high school. While kids in areas where schools are open continue to build their education in preparation for either college or career, ours are falling behind and will pay a price for this once they become adults. We now argue with our kids routinely as we attempt to get them on devices, TV, or social media, doing this all while we are supposed to be at work. They have almost nothing to fill their time. The virtual format OSD has provided is completely inadequate. I don't necessarily blame OSD for this. The school was never meant to be virtual. I do, however, place blame on OSD administration for instituting this format when they are not being forced to by anyone. Just down the road, schools offer in-person learning. No significant difference in demographics or infection rates, only a different name of the county. We are making this decision by choice. Nobody is forcing this on us. Not an easy decision, of course, but ours to make and should be with our children's future and mental health at the top, not public opinion, data from other cities, or outside influences. We are Oregon and should make our decisions based on relevant data, which at this time shows no reason to close our schools in entirety. Our children are showing behavioral and other issues that are directly related to a vast amount of free time and lack of interaction with teachers and fellow students. We as parents have lost significant income and are forced to juggle schedules every day as we need to be home with our kids now. As you know, young kids should never be left alone all day for a variety of reasons. Luckily, we were able to make some tough decisions to be home with kids in lieu of making our normal income. Other kids may not be that lucky with parents that have no other options than to leave them alone each day. I'm not forced to choose between a sufficient income to provide for my family or making sure my kids are not left to themselves each day. This cannot go on much longer for our family. The virtual learning format we have currently is absolutely unacceptable. We track their time and study materials. It isn't even close to what we expect for our kids. Last year, when one of my kids missed school to go on vacation, I was issued letters stating we could receive truancy violations for missing too much school. Now they get a day's worth of education in an entire week. Have state laws on required education days changed? I believe everyone understands that anyone with health issues needs options. Whether it be parents, kids, or faculty, having a virtual option is understandable. We all understand this is challenging for you as much as it has been for all of us in our personal lives. We do not expect everything to be perfect or be right on every decision made. We do, however, expect that our kids are not put last. I, for one, would be glad to take any risk relating to contraction of COVID if it meant my kids getting back to a normal life and being successful later on. I have a feeling many, if not most of our great teachers feel the same. Why do we now have an option for teachers, parents, and students that want to return to school? Board members and the superintendent are not at risk with school opening, so how about asking directly without leading questions who is willing to go back, including teachers? We should all have freedom of choice, including faculty, and a direct return on our taxes we pay for our child's education. It appears that we now are in a place where decisions being made are put our kids in the last place. If this does not change very soon, our family will be taking action on other education options. We have looked at enrolling into other districts, moving to another area, homeschooling, private schools, and supplemental virtual learning. We do not want to do any of this, but are no longer willing to sacrifice our children's future or continue to lose income for a disease that has an extremely low chance of damaging our kids. Unless we are properly informed of the district's plan to offer an in-person option for families like ours, we will be leaving the district. You are now setting a precedent that will have unintended future consequences. What will we do when we have an influenza outbreak in the future that statistically can be similar or worse for kids? We need to know that our district's focus will always be on our kids first. We cannot live in a place where we let the response to a problem be worse than the problem itself. Please do not suggest that your concerns are for parents contracting COVID from the students. We are all capable of making the choice ourselves, and just as the teachers are. Give us all the choice and let us make this decision individually. Please do not take on the role of protecting the public, instead focusing on putting our kids first. The data shows us that they are not the ones at significant risk. We can make our own decisions in our best interest individually. Other similar districts were able to open. Do you think they are irresponsible? They have a mindset that is putting kids first, and their actions taken show that. Even if they need to close temporarily due to local conditions, it seems their goal is to reopen as soon as possible. That should be our objective. Dane County school policy has now become an outlier not only within our state, but also our country and most of the world. Let's follow protocols that others have taken in relation to school openings, which data shows has caused no increased harm. I have a multitude of links and information available if anyone is interested in looking into facts and data on COVID in relation to school closures and school-aged children. I'm glad to share upon request, but believe you have already received this data from other parents as concerned as we are. If you have conflicting data, please share it as well. Again, I have found little data supporting closures when weighing against unintentional damage to kids, but I'm glad to look at anything that supports your position. We need a plan very soon, and we need it relayed in clarity to the community. We need to know if and when we can get our kids back in school and when we can return to our normal work schedules. I do see we have money in the budget for COVID precautions, so let's start spending it. Using PHMDC metrics, we may never open schools again. Let's make our decisions and take leadership. This virus may be with us for a long time, so let's figure this out before our children's futures and mental well-being are harmed further. Also, I've attached a screenshot of our school board members' Facebook message relating to our president. Regardless of anyone's political beliefs, I think we should all agree that this language sets a horrible example for our kids. Many kids did see this. Let's please stay focused on local issues in relation to our children's education and not bring further divides into an already challenging situation. We cherish all the great teachers in our district. Let's unleash all of them that are willing and get our kids back on track. Just as grocery store clerks, gas station attendants, police, EMS, etc. have met the challenges, I believe our teachers can as well. This should not be a unilateral decision. It affects everyone. Thanks for considering our viewpoints. I sincerely hope we have an immediate change in direction. Regards, Robin Heather Hill. Do you want me to continue? I have 4 left. 5. You're on mute, Steve.
There we go. We're at the gonging hour.
Okay.
We're limited to 1 hour. Why don't you state the names of those who submitted documents? The board will get those and we'll post those if they're willing to let us post those.
Dallas Rose Rogers, Jenny Haley, Sarah Schleim, Rochelle Lemke, and Kylie Ogadogo.
Okay. Thanks, everybody who submitted information to us to be read tonight. As I'd indicated at the outset of that, our board policy limits us to 1 hour for that type of communication, and we're at that point, and we'll make those available to all board members and also to the public online if they so desire. We appreciate all the comment and the interest in our district. All right, let's move on to, that takes us out of the information items. Action item C, there is none. Discussion items, committee reports, anything to report from policy tonight? Anna?
No report tonight.
Troy, visioning.
Visioning met on September 22nd, I believe it was. We reviewed the draft number 1 of district goals for 2020-2021. I would say we made significant progress on reviewing those goals and sent that back to Dr. Bergstrom. She's working on refining those goals. I will update the board. We did have a meeting scheduled for this coming week. I think it was Thursday. We're going to push that. Dr. Bergstrom is in the midst of working on developing some of those goals, specifically the equity goal. And with the additional meetings that we have this week, we're going to push that to a future date. So you can take that off your calendars. And that's all I have.
Great, thank you. That takes us to informational items E, opening of school update from Dr. Bergstrom. And then when you're done, Dr. Bergstrom, we'll do what we've done in the past is I'll rotate through the board members and ask if they have any questions, provide any comments or feedback to you, just like we have done before to keep you in the loop and to let you know where we're sitting as board members. Okay, so floor is yours, Dr. Bergstrom. And Troy, you'll be first up when we do the questioning with Tim second.
Thank you, everyone. And thank you to all of you who wrote in this evening. It's important to hear your voices. So we actually have a rather lengthy presentation tonight because in addition to the school plan update, we are also folding in the mental health report that usually happens in the fall because it's so connected to the school plan update. Consequently, we'll probably answer questions after Candace has presented that component of the presentation tonight also, just to make sure that everybody has a well-rounded perspective on where we're at and what our next steps are. So I know people have seen quite a bit of this particular graphic, and as I discuss our plan and moving forward, I as always, want to ground ourselves in our principles and the fact that these principles have remained constant throughout the process. And you've already seen components of each one of these in previous slideshows. Equity, of course, at the center, with the whole child emphasis as part of our values, creating an inclusive environment for our students. Health and safety is always a top priority. That commitment has not changed. And you've seen how we started out the year with a strong focus on mental health and social emotional learning, because that is really the foundation for a high quality education. And then of course, flexibility and adaptability is a constant and that's been pretty relevant in the last few weeks. And for that reason in particular, I want to give you just a moment to take a look at the next slide. So just an overview of how we have approached the fall thus far. Now, I know we talked about this all the way back in July, and this has remained consistent. And that is our Oregon Online students selected, and that's about 25% of our entire student body. Their families selected a full online experience for the first semester. And we will, of course, be asking them when the time comes, their preference for second semester too. And that online model will stay consistent. The model that the majority of our families opted into is the Oregon Phased Restart. And that's where students will participate in a learning format that's being implemented by the district that aligns with the public health guidance. So a little review, and now just a reminder. Our goal is no different than the goal of the people who wrote in tonight, no matter their perspective, because everybody's goal, our shared goal, is to get our students back in school. And I do believe that that is what all of us want. We might have different ideas as to how and when, but that is what we all want. If you take a look at these pictures, you can see this is what school should be for our kids, right? It should be all of these hands-on experiences. It should be all of this collaboration with one another. And that's exactly what we want too, right? We're educators. This is what we've given our entire life to do. This is what we want for our schools. But right now we are in a pandemic. And there are constraints and there are safety requirements that make school as we have been used to it difficult to impossible to do. And I'm not saying a hybrid model is impossible. I'm just saying students sitting this close to one another, students doing some of these things in small groups. Those things are not what we're able to do right now. But we are able to do our very best to deliver the best possible virtual instruction we can at this moment. And for our K2s, some in-person instruction. And as we go through the presentation, I think you'll see some of the other in-person components that we are prepared to implement. Now, just to give everybody some context, because it's important to think about our phased restart students in K2. They started this week having half days in person. And that is something that has put us sort of at the pushing forward edge of the county. There are 16 school districts in Dane County. 6 of those school districts have K2 in person. So the majority of school districts in Dane County right now are all virtual. We were, I believe, the 5th school district to start the K2s in person. And if you include our afternoons once a week, then we were one of the first. So we are willing to push for in-person when public health is telling us that it's safe and allowable to do so. So with our phased restart, this is the closest thing we have right now to in-person. It's with our youngest students. And as I said, this week we expanded the in-person for the 4K through 2 grades. Our 4K students come in 2 times a week, and our K through 2 students come in 4 times a week. They're either in the morning or in the afternoon. And if you take a look at this picture of one of our classrooms, you will see that this is what our classrooms look like now, because we are being very strict with the 6 feet of physical distancing. And we'll talk a little bit more about why that's so important in just a moment. But what's working really well to have our students back in our schools, our youngest students, just being able to have them back. I mean, it's a huge relief to be able to see them in our schools and know that we're providing them with a safe environment. And we're providing them with some social interaction, because it certainly isn't social in the way we are used to. And I think that's super important to remember. It's not how it was before, but they are in school with their teacher around other kids, and we're excited to be able to do that and feel as though we're doing it safely. Now, the challenges, and there still are some, the challenges really are around illness and substitute shortage. And it's not that, I mean, of course we don't have a lot of substitutes in the pool right now, but we'll talk a little bit more about how illness becomes a challenge. And it's not just illness with COVID, it's that plus some other things, and we'll get to that in a second. Contact tracing, that's a challenge. It takes up a lot of time. I would say right now it is probably Gina Jonin's full-time job, and that does not include our 2 nurses, who at the moment are the ones who do the contact tracing for students. Gina does the contact tracing for staff. Another challenge is the number of staff we currently have in quarantine. And finally, another challenge is providing for consistent, high quality instruction when students are in quarantine, because it's just a little more challenging than one might think to be able to do that, and do that well when we know the students are at home, but now K2's primary instruction mode is in person. So we've come up with a few workarounds, such as having our quarantine students temporarily join Oregon online classes, but we know that's not a perfect solution either. So I just really want to highlight a little bit more about contact tracing, because I mentioned that it's a process that takes quite a bit of time, and it's a really, really important process, because we are committed to ensuring that now that our schools are open, we want to keep them open, and we want to be able to continue to open more grades. And in order to do that, we have to make sure that our procedures are really, really strong. And we feel very confident about that right now. There is absolutely no lack of clarity regarding what we need to do. It's just a very time-intensive process. So for contact tracing, you can see that there's 4 bullet points here, and those were in the family update that went out last week too, to make sure that everybody understands what contact tracing involves. And when we say someone is a close contact, it means that their contact with the person who has a positive case of COVID is in one of these 4 areas. So for our students, it's most likely the first bullet point for our students and for our staff. Being within 6 feet of an infected person for 15 minutes or more, starting from 48 hours before illness onset, or if no symptoms, 48 hours before the date of the test. So that 6 feet, that's the reason that we are ensuring that there are 6 feet between each desk in the classroom. And that's one of the reasons that the teachers are working so hard to keep students in their desks, because that way, if someone does contract COVID, we wouldn't necessarily have to quarantine the entire classroom, unless, of course, we couldn't guarantee that they remain 6 feet apart, which honestly is the reality. We know we're talking about little children, and we're not always going to be able to get them to do everything we want them to do. So while teachers are being absolutely amazing in putting procedures in their classrooms that allow students to stay safe, we know that there may be times when students are within 6 feet of one another, and we may need to, at some point in the future, quarantine a classroom. We're just doing everything we can right now to make sure that doesn't happen, because we really want to ensure continuity of instruction. We want the kids, once they're in the school, just like we want our students who are in the virtual classroom, we want there to be some continuity in what they are experiencing, and not a lot of in and out and in and out. So here's the reality of the current situation. So as of September 1st, because we did have Ready, Set, Go conferences, so we did have in-person contact during that first week, and then we moved into once a week for our K2 students, and now we're K2 half days. So here's where we're at currently. Thus far, since September 1st, we have had 6 positive staff cases and 3 staff members who are currently out due to positive cases. Thankfully, only 1 case of a student at school who was positive for COVID. You see, we've had quite a few staff members in quarantine. And I want to assure people that the quarantine, in the vast majority of cases, is coming from something that's happening outside of school. However, they've been exposed somewhere outside of school, and consequently they need to be in quarantine. And that means that there are sometimes a lot of positions within a school that are going without coverage, and people from all over the district are doing everything they can to help. So when we find out a school is going to be short, the principals all take a look at their schedules, see what they can do to cover it, because we're really working hard to ensure that we have enough staff in every single building, not only to provide a safe environment, that's number one, but also to provide that continuity of instruction. And so out of the 35 staff members who have been in quarantine since school started, 15 are currently in. And for students in quarantine, that would, of course, include anyone from our K2 group, but it includes students that we are aware of that are not in the K2 group. And when students are not in in-person instruction, public health is not required to let us know. So we don't know necessarily how accurate that 39 is, because we are really focusing in on contact tracing and making sure the numbers are right for the students that we have in person. So that would be our K2 students and a lot of our special education students who are coming in for increased services. Now, in addition to people being in quarantine or having a positive case that leads to quarantine, their own or someone in their family or someone to whom they're a close contact, the other issue is absences that are due to our caution, right? Because public health, and that comes directly from DHS, has given a symptoms checklist. So that every day we're asking staff to think about this. And this is something that we've sent out to families too. You can see on the top of the screen in part 1, if you have yes to any of the symptoms in part 1, whether you are a student or a staff member, you should stay home. And you go down to part 2, if you have 2 of those symptoms, you should stay home. Now, if you look at those symptoms, you'll notice that they're symptoms that are often common with a cold, in addition to being symptoms that we should be aware of for COVID. But because we don't want people to come to school when they're not feeling ill, we're asking them to please follow this checklist. Consequently, we're expecting that there may be more absences than there might have been otherwise, because people often come to work with a runny nose. And now we'd probably rather, if you had a runny nose and a headache, that we want you to stay home. And that's for students and that's for staff. And so we will have more absences, whether it's our students or our staff. And consequently, we have to always be thinking about how do we create that continuity of instruction when we know that there may be students who, for lots of reasons, aren't going to be able to be with us even after their grade band is being seen in person. So let's talk about that. Let's talk about when we're going to see some of our students in person. Now, you'll notice that other districts in the area, many of them have made statements such as, we're committed to virtual learning for all of first semester, as an example. And really where we are is we are committed to virtual learning only as long as we have to. And if we meet those metrics before first semester, then we are ready to go. We are ready to have in-person learning as soon as we meet those guidelines without delay. And that's one of the reasons people often ask us for a timeline. And I'd love to be able to say that we're doing this by January 20th, let's just say the first day of second semester. But in reality, we're waiting to meet those metrics. If we meet them before semester, then we will start in person before semester, because that is what we are committed to. We don't want to wait around if we don't have to. So for 3-5, we have started the planning. We've asked families to make an AM or PM selection so that when we get the green light, when we have met the metrics or are close to meeting the metrics for public health, and we'll be able to see that coming for a few weeks, right? We'll see the numbers going down. So everybody will know this is coming. We don't want to meet the metric and then say, well, in 2 weeks, we'll start in person. We should be able to see this coming far enough in advance so that we have everything ready and we get to go. So for 3-5, they'll be following the same half day piece that our K2s are following. And of course, it'll be a little bit different, but for the most part, the times for in-person will be similar, as will the areas of emphasis, which for our in-person learners for K2, when they're in person, it's language arts and math. They have instruction in all the other important subject areas too, but that happens the opposite time of their in-person learning. So I'm going to go now to grade 6. When grade 6 comes in, they will have a similar schedule to the K5s, because remember, we still have to maintain social distancing. Consequently, that's why we have to have a hybrid model for when we first move into in-person. So grade 6 in our district, they're either at the intermediate school or they're at Forest Edge. Consequently, it makes much more sense for them to follow the schedule of all of the other students in their school, as opposed to creating a very different schedule for grade 6 and to make it more like a 7 through 12. So we are putting grade 6 into the bucket of 3-5 as far as their schedule goes. Now, right now, public health metrics have them attached to a 6-12 as a group, as opposed to the 3-5. That's a piece that we're still discussing because personally, we would really love to be able to see them together with the 3-5 grade band as opposed to waiting. So now, we want to talk a little bit about our grades 7 through 12 phased restart. We know there's been a lot of interest in the in-person options for our secondary grades. So that's what we want to spend a lot of time talking about this evening. So as you can see, our guide for evaluating the alternatives, it starts off with the guiding principles of what's guided us throughout this whole time period. And then we start looking at some really specific things, like for health and safety. And remember, I'm talking about our 7-12s here. We have the health and safety procedures. That's all in place. So it's not as if we need assistance developing procedures. That's not the case whatsoever. That's in place. We just know that whatever option is implemented must have these health and safety features in place, including the 6 feet of physical distancing. We also know that our emphasis has to be on one of our values as a school district, which is relevant and empowering learning experiences for all of our kids. And that means our phased restart and our Oregon Online, right? We don't want to start something in phased restart that significantly reduces the quality of Oregon Online instruction. We looked very hard and worked very hard to find a model that would allow us to do both equally well. And that's a challenge. And Jim and Shannon will talk about that a little bit in a moment. We also know that we have to have supports and reasonable workflow for the students and for the staff. Making sure the students have the supports necessary for the in-person learning to happen and to be continually successful in the online learning, that is a part of our planning. And always a part of our planning is how do we make this whole unusual situation as manageable as possible for our staff, because they're working their tails off. And they, I can't say enough about all that they're trying to do and the care and the thought that they're putting into every one of the experiences that our students are having online and now in person. Really, you couldn't ask for anything more than what they're doing right now, and I have tremendous respect for all that, all the heart that they're putting into what they're doing. And then finally, and I mentioned this before, and you will hear it a lot tonight, the importance of the continuity of instruction for both the students and the staff. If there is illness or there is a required quarantine, how do we make sure that when students, and remember I said when, not if, when students are quarantined, when staff are quarantined, there is some measure of continuity so that we are not placing people in odd online courses for 2 weeks and then bringing them back to their teacher later. We want this to be smooth as it can be, given our very unusual circumstances. And a really important component, particularly for people who aren't necessarily familiar with education, is the differences between elementary and secondary. Because when Jim and Shannon speak tonight about the plans for 7-12 and the hybrid models that were considered and the hybrid model that was selected, it's important to note there are significant differences between our elementary schools, and we're including K-6 in this, and our secondary. And the first would be that there are general academics that apply to all students. Now, with some exceptions, because we do have some students that have specialized needs, but for some with few exceptions, there is the language arts class and language arts standards for 4th grade, for 3rd grade, for 2nd grade, right? So if you're in a 2nd grade class, there is a 2nd grade curriculum that, with some exceptions due to specialized needs, varies, but generally that's the curriculum. Also in elementary teachers have a general license, which means they are licensed as teachers to teach multiple subjects in an elementary school. Now, that isn't necessarily the case for someone who's teaching general music or art or something specialized of that nature. But if you are a classroom teacher in 2nd grade, 3rd grade, 4th grade, you have an elementary license that allows you to teach all subjects. And in an elementary school, the teachers are assigned to, a teacher is assigned to a group of students. So there's one teacher and there is his or her 23 students, 24 students, right? And they teach students all the subjects, unless they partner with somebody and they share the work and they treat it as a little pod. But generally, they're licensed to teach all subjects. And because of that, we were able to dedicate specific teachers to Oregon Online at the K-6 level. So there are a certain number of sections at each grade level that is for Oregon Online only, and a certain number of sections that are for phased restart. That is not a possible model when you get into the secondary level. And I'll talk about that briefly, and they'll explain it more in relevant ways later. But for secondary, as you know, we have much more customized academic options and choices. So there are lots, for example, if you're a freshman at the high school, there are many science classes you can take. And what's really important to note is that science teachers have licenses that, that allow them to specialize or that allow them to teach certain subjects. So it's not as if there's one license and you can teach absolutely everything that comes under the heading of science at the secondary level. That's not how it works. And that's not necessarily how something like math would work. You may have a math license, but just because you have experience teaching algebra doesn't mean you are necessarily the correct choice for teaching Calc BC. It depends on your experience level and your background and everything else in between. So we don't have the same amount of options due to specialized licensing. And remember, at the secondary level, teachers are assigned to teaching specific subjects. They don't have a group of 25 students other than in their advisory. They have 135 students that they are teaching a specific subject to. Due to these differences, at the secondary level, all teachers teach both Oregon Online and Oregon Phased Restart. Really important distinction that plays a large role in the selection of a model. So what was considered? Well, a couple of things, and you'll hear much more detail when you talk to Mr. Pliner and Dr. Anderson. But for the live stream model is one that was considered, and this was all done after discussion with leadership teams, visits to other schools, considerable research that started in the summer. And we have continued to hone in on what we want to do because we want it to be the best. We don't want it to be good enough. We want it to be the best possible model it can be. Consequently, we've used the last month to visit schools, to talk to other educators, and to ensure that our selection really was the best one possible. So for live stream, that's when the instructors teach phased restart within their classrooms. The students who are in person are sitting in the classroom, probably half of the students, because remember, we still have to have the 6 feet of distancing. And then Oregon Online students watch the classroom as it's being filmed by the teacher in real time. Mr. Kleiner will talk, and Dr. Anderson will talk a little bit more about that in a little bit, but it's where the teacher's in front of people and there are kids at home watching it online. That's live stream. The flipped model, that's when it flips the traditional classroom model. The kids have the instruction outside of class time, and in class time, that's when they're experiencing teacher guided practice and projects and checks for understanding, etc. So those are the two models we've spent a lot of time on. Outsourced online is something that many, many districts have done, which means that you contract with a company and you pay that company either by student or by subject area, and everybody who's Oregon Online just takes classes from that company. So it's something that as part of the academic planning team this summer, it was an option that was considered and dismissed, because we want our Oregon Online students, no matter the grade, to receive the curriculum that is created by our teachers and delivered by our teachers. That's something we thought was really important, because we believe in what we do, and we believe in the quality of instruction that our teachers are putting out there for us right now. And not just now, but always. So for the next slide, slide 16, I'm going to pass this over to Dr. Anderson. She will start talking a little bit about some of the things that have been discussed and some of the pathways for moving forward. And Dr. Anderson, you can just tell me when you want me to start moving slides.
Okay. Thanks. So good evening, everyone. Thank you, Dr. Bergstrom. Jim and I thought it would be helpful to begin with just letting you know sort of the demographic breakdown of when families selected in August if they wanted phased restart or Oregon Online for each of our schools. And we have had some families flip-flop back and forth over the course of the last month or two, and we're able to accommodate that because our learning is all virtual at this point. These percentages are, as Dr. Bergstrom mentioned earlier, is for first semester. So this is the population that we're serving for first semester that we need to keep in mind for our planning. Tonight, we're gonna talk about some different cohorts. And so I want to make sure we're all on the same page with what we're talking about for language. As Dr. Bergstrom mentioned, we need to make sure that we have 6 feet of social distancing and a lot of space. And so for that to happen with 72 to 75% of our students, we needed to divide that student population into 2 cohorts. We were very creative with the name. We call them cohort A and cohort B for now. So as part of our plan, we'll be thinking about splitting that population in half. And then we're going to refer to our students who are fully online and committed to online learning as cohort C. So just keep that in mind because you'll see it again in our presentation. Next slide. So as already mentioned, physical safety and keeping our students safe is of course at the forefront of our minds as we plan and think about bringing all of our learners into our buildings. And so again, that 6 feet of social distancing, having students wear masks, thinking about keeping hands clean, sanitizing surfaces. We don't plan to use lockers in our building, having students enter assigned doors, all the precautions that our K2 colleagues have used. But we just want to assure you that we're thinking about that. And at the same time, things are going to look a little different. And so Jim's just going to talk about some of the things that he's seen on his visits that he's done in some local schools.
Good evening, everybody. I want to verify one thing before I get started. My wife just texted me from home saying, turn on your camera. Am I on? Okay, fantastic. You know, I visited schools, high schools in the Badger Conference, and I want to affirm a few things before we get going. Number one, we want to be open. We do. We really miss our kids and we miss our staff. We miss our teachers have worked incredibly hard. I appreciate Dr. Bergstrom saying that. We have accomplished so much in such a short period of time, blocking the high school schedule, really a heavy lift on becoming adept at virtual instruction. And our planning teams have donated hours and hours of time throughout the summer as a part of the academic planning team. As the bullet point here says, it will feel different. There's no question about it. We want to get back in person, and being back in person doesn't automatically guarantee that the instructional experience will improve. What it means is that it gives us an opportunity to have some of those social emotional supports and being in the presence of kids and having students interact as well as teachers. And so there's a big social emotional bump to it as well. But it will feel absolutely different. And we'll talk a little bit in more detail about what that would look like. Next slide, please.
So as Dr. Bergstrom mentioned, one of the models that we looked at is like a live stream model, or some schools call it a simultaneous model. And what that looks like is all students receive their instruction, regardless of the cohort, at the same time in a live lesson. And so here is a photo of what you see. And you see a handful of students in a classroom. So in our case, that would be like one cohort. So maybe cohort A isn't in attendance on that day. And then if you look at the TV, what you see there are students in Google Classroom, which is the platform we're using. And those are the online students. So in this case, it would be like our cohort B and C would be at home watching the lesson. You see the teacher, she's the one standing up with the blonde hair, you can't see her face. She is standing at her computer in front of a camera, and she's delivering the lesson. And this model is really much more teacher-centric. And by that we mean the teacher presents the lesson and everyone listens and watches it. In this model, students pretty much get their content delivery, but then they do the projects and the lesson and the homework outside of the learning space. So the focus is really on teacher delivery. When we were looking at this model, we were trying to look at it from lots of different sides, because this is a model that a lot of schools are using around the state. And so we tried to really study and analyze the pros and cons, and also talking to other teachers and administrators who are using this model. And so next slide. We took a look at some of the things that we thought were really good and helped us to achieve some of the principles that we were trying to achieve for our learners. One of the things that we liked about this model is that it's synchronous instruction. And we learned from the spring, and the feedback from students, staff, and parents is they liked synchronous instruction, and they liked that structure. We also decided that having that support of students coming into the building, and we heard that need a lot in the letters tonight, that the ability to come into the building and for kids to see other kids and see their teachers is really great for their social emotional sense of self and well-being. Another pro is that it's an effective use of teacher time. The teacher delivers the lesson once and they hit all 3 cohorts at the same time. So those are some of the things that we heard and saw that were really effective about this model. On the flip side, and again, no model is going to be perfect, but some of the things that really stood out for us is that it's really difficult to engage all groups at the same time when you're trying to deliver this lesson. And we pulled a couple pictures to show you. And in the top picture, you know, the teacher's really focused on the students who are online, but the kids in the classroom are just kind of sitting there and waiting. As a teacher, you might design a lesson to be very engaging for kids who are in an online environment. And I'll reiterate, like what Jim said earlier, our teachers are doing a fantastic job trying new strategies and highly effective practices to really meaningfully engage students when they're online. But the way you engage kids when they're in your room is totally different. And so it's really hard to have best practices in both worlds at the same time. We also saw, because of that, the kids who were online learners, it was much harder for them to connect because now they're sitting there waiting because the teacher's dealing with that and there's kids in the room and they're not able to connect with those kids very easily. A lot of recommendations that schools had is they wish that they had a second adult in the room. So for this to really go well, you almost need one educator who can help monitor and engage and support kids in the classroom, and then someone else who can monitor the chat and see if the kid's having a technical difficulty. And without that second staff member, it becomes really difficult. And that's a barrier for us because we don't have 2 adults for every room. There also could be some potential concerns. Dr. Bergstrom talked earlier about teacher absent. If the teacher who's delivering the instruction in the room can't be there or is unable, not well enough to teach, then that continuity becomes difficult. Another challenge has to do with technology. And in many cases, it is having to do with sound or visibility. And last week at the school board meeting, I had a really unique experience that helped me to think about why this model wouldn't be best for our learners. During the annual meeting, for example, Andy gave his presentation. He was right in front of the Chromebook. I saw his slides. I was sitting in my office and I could hear him clear as could be. He was very easy to follow. But then later in the meeting, when the board members started having conversation, I couldn't see you. And I had a really hard time hearing. And if you were sitting closer to the Chromebook or the camera, I heard you. But if you were farther away, I lost your words. And I found myself like chatting other people who I knew were at the board meeting. And I was like, wait, what did they say? What did I miss? What happened? And I felt super disconnected from the community and everything that was going on in that space. And so that is a concern because we don't want our two cool home missing out on what's going on and what's happening in the classroom. So those were just a few things that kind of to make our thinking visible as we analyze that model. And so Jim is going to talk about the other model that we looked at.
So we've learned a lot in our distance learning that will serve us well moving forward into a hybrid instructional model. If I'm Mr. Johnson's chemistry classroom and I am instructing students on Boyle's Law and we are in a live stream model, I'm going to be masked up and I'm going to be trying to lecture in such a way that both people at home and the students in front of me can gather that information, take their notes and ask whatever questions they need to. That formatted doesn't lend itself extremely well. And what we would be doing in a flipped model is new instruction would be delivered asynchronously. So Mr. Johnson's Boyle's Law lecture could be delivered through a video lecture, screencast, accompanying slides, and other readings, podcasts, etc. Then when we come back into the classroom, that time is used for teacher-guided practice, reteaching, pre-teaching, discussions, application, perhaps illustrations, labs, and helping those kids support their online learning in that in-person resource environment. So in a sense, that the students are still engaging in distance learning for new acquisition of content, but are supported in that learning in person. And additionally, then we can pivot from carrying that load to shifting it to students and having students applying their learning in our presence, mini lessons, etc. Now, in our model that we'll talk about in a few minutes, we will also talk about creating that resource time for our Oregon online kids so that they get that support time with their teachers as well. So let's flip the slide, please. So again, the positives here is that we are not fighting through a mask and trying to deal with teaching into two formats, that we can use the lessons that we've learned with distance learning to create engaging, coherent instructional lessons. And again, coherence is incredibly important. What Shannon experienced in that board meeting on a broader scale, a new learning, creates challenges for students to learn in a coherent fashion. So and again, being in person in a hybrid model, it gives us an opportunity then to utilize that time more flexibly when we are with students. It gives us a real focus rather than cramming content in that teaching time, but really to focus on our student wellness, their learning, and monitoring their progress on the essential learning standards that we have. When we look at the other side of the ledger here is that I can tell you that what our teachers tell us in feedback is in the distance learning model, very often they will spend hours of prep time for a lesson that has 1 hour of runtime. So it might be as much as 3 hours working on a Pear Deck and slides and a screencast. And a kid can roll through that in 45 minutes to an hour. And it has taken an inordinate amount of time to produce lessons that are effective and, differentiated and really cover those key concepts. So this is not without its challenges. It's quite labor intensive. And that, I guess the other criticism that people could say is that we want that new learning taught to us by our teachers in person rather than in that distance learning format. For a lot of reasons, we feel though that it is a real strength that this flipped model will serve us well. Next slide, please. So back in April, John Tanner brought together a group of about 60 educators. John, is that right? Give me a thumbs up if it was roughly 60 in our district as the academic planning team. And that planning team worked extremely hard on all phases of the instructional side of the house. Andy led the safety side of the house. And one of the large outcomes in the instructional areas that was, again, teacher-led was the fact that flipped model really had the highest ceiling when it came to instructional value in a hybrid model for serving all 3 cohorts. So again, we have our challenge then, and Shannon and our challenge is always to have a plan and to have a plan ready to go that serves our kids in our community in a high fashion and really is workable for our staff, because this is a very challenging time for staff and students. And as administrators, we are equally concerned about serving all of our constituents in our community at a really high level and setting everyone up for success. So let's flip ahead.
All right, so on this slide, what you see is what the middle school schedule could look like. And I say could because I think every couple days we make changes to it as more ideas and questions come. So view it a little bit more conceptual at this point, but I want to walk you through it because I know there's a lot of visual information on this slide. So remember, we have 3 different groups, A, B, and C. A and B are your phased restart cohorts. And so in this model, where the orange is, you will see cohort A. And in cohort A, you're going to come to school 2 half days a week. During that time, you will have close to an hour with each of your teachers, and you're going to be meeting, of course, in that smaller group, socially distanced with your teacher. Our art teacher said that during that time, she would have kids work on projects and she would go around and give them feedback, show them techniques, strategies as needed. A math teacher might go through the lesson from that week and really focusing on question 3 because it was really hard. Going around, connecting with kids, providing that resource support that they need. Now, if I'm in cohort A, what am I doing the rest of the time? If you look in the afternoons, 4 days a week, our connections group, which is like our homeroom, and we do a lot of social emotional support, our TV news show, different games and talking activities, that would be done synchronously online where all 3 groups come together. So if I'm in cohort A, I'm going to have a touch with OMS with other students 4 days a week. And then the rest of my week will be those asynchronous flipped lessons that Jim was talking about. Also layered within this, if I am in band, I will have my small group instruction with the band teacher. Our teachers have a lot of other supports built in, but basically in a nutshell, I would come to school 2 half days a week. I would leave at lunchtime. Instead of serving lunch, we would like to provide a grab and go bag lunch so our students have food as they're walking out the door. If I'm in B cohort, it'll look very similar. I'll just come 2 different days and then have my connections in the afternoon. Now, Jim mentioned this, but if I'm in C cohort, so if I'm in the Oregon Online, my support with my teacher will be in the afternoons, and I will get to see my teachers throughout the course of the week. We anticipate this will be smaller because at the middle school, it's 28%. Most of our classes are around 28 to 30 students. So I might get like 30 minutes with my math teacher with 6 other students. And so that's a small enough group where I can have some discussion, I can get some feedback, I can ask questions. And so that teachers still get that support and that connection, both with other students and with their teacher during that time. Now, we also talked about we need to come up with a schedule that's fluid. And so if I am in Oregon Phased Restart Group A and I get exposed to COVID and I can't come for 2 weeks, I'm quarantined, not a problem. I join that C group for those 2 weeks. Because as Jim described, the lesson, the asynchronous learning, that core flip is the same for everybody. It's the resource that can be flexible and can change. Jim is going to talk about the high school schedule now, but you're going to see we tried to build something that was pretty similar.
Real similar. So we will have 5 days of paced instruction for every student based on our block schedule. And students will be supported in each of those classrooms in cohorts A and B. They will be in-house 2 days a week, and we'll have the opportunity to receive extension, support, coaching, classroom discussions. When I was one of the high schools I visited that employed the flip model had a weekly roadmap, and it indicated for the kids the 5 days of asynchronous learning that students would be engaging in, as well as what they would be doing on their in-person sessions. So it's an opportunity again for our students to engage in deep and meaningful learning. As Shannon had said, it provides us with support for all 3 cohorts, or really Oregon Online and Oregon Phased Restart. And then each of my teachers would meet with each of their classes virtual, that C group, in the afternoon. There is additional in those afternoons, a bit of additional planning, prep, and production time, because there is a significant uptick in keeping multiple environments up and running throughout this as well. Okay, next
Ready?
slide. Okay.
So now you know what our plan is and what our thinking is right now for when we can bring in larger groups of students. But we've also been thinking about how can we serve some of our students with the greatest need in the short term. And in 5th through 12th grade, we've already started doing that, and that will become a bigger point of service in the weeks ahead. So we wanted to make sure you understood what we're trying to do. And I heard it very clearly in many of the letters tonight, the needs for some of our highest needs kids, and we're going to try to meet those. So we're looking at probably less than 10% of our student body at each of the schools. And we're thinking about sort of this idea of learning hubs or support hubs where there's a designated space. So for example, at the middle school, we're looking at creating a very socially distanced space in our cafeteria in the mornings, where we'd have it supervised by a paraprofessional. Our administrative team, in working with our teachers and our student services team, would identify the students that we feel have the greatest need in the short term to just come into the building. And so for some of the reasons are families with major internet access, and that's usually families, as you heard tonight too, who live in the country. Like, we've given them the MiFi, we've done everything we can, and it's just not working. So they might come in and do their online learning at a table in the cafeteria. They just need internet. We have some students who just need an adult to just like help them get into Google Classroom, and then they're good to go. So it might just be some technology support. We have, thanks to the Friends of the Oregon School District, some mentors that have been working with our students. We had our first mentor, our very own Steve Zock, come to the middle school today to meet with a student. And then some kids just need a quiet environment because their home environment is not conducive to focus and learning. And so they might be a student, like that's their big barrier to learning that we've identified in working with their family and staff. Some students just need the routine that they are have opportunities to increase their executive functioning skills. And so just by having them come into the cafeteria and be supervised to come into class, maybe it's to ask a question. Our student services team, and I know Candace will talk to you in a little while about all the amazing things that they have been doing. But our student services team is hoping to also start some either small group or one-on-one mental health support for some of our students where it just isn't working virtually. I want to reiterate something that Jim said earlier about how hard our staff has been working. I've been in this district for 12 years and our staff is amazing. I have never seen our teachers and our staff work harder than they have now. And they have been so positive and so solution focused. And they are going above and beyond and trying to figure things out. And even with all of that, we know that we can serve our kids better. And so we're hopeful that by bringing in some students really targeted, and our parents have been awesome too. They have been so collaborative. But we hope that this just extra little boost of support will help some of the kids just really settle in. Jim's going to talk a little bit about all of this going on at the high school, but it's some things that are going to look a little different for some opportunities at the high school level.
Yeah, I won't work. Our bullets are quite similar. I won't work all the way down that list again. We are, again, we will be opening our cafeteria as a Wi-Fi hub and a supported study environment. My wonderful instructional coach, Andrea Anderson, puts together a peer tutoring program that is very robust in typical years. And she has been arranging some virtual options for that. And now we have her working on some in-person opportunities for kids to come in a supervised environment and appropriately distanced to receive support. We've had a number of our case managers in providing IEP support for students, as well as some of our interventionists working with one-on-one or small groups of kids in our building where that is sorely needed. Our high school tech ed department is really excited about opening up opportunities for kids to come in and do some labs, to change the oil and to do a brake job, with Ned Lease, as well as finish up a woods project or to do some application of online learning and some of those real hands-on courses. And so that is starting as early as this week. So we're excited to see that. And Kim Griffin, my AP, who's really involved in a lot of the protocols and safety movements in our building, is got systems ready for students and staff to jump right into. Leslie, I'm good with this one.
Thank you. And then the next one, I believe, and thank you, Dr. Anderson and Mr. Pliner. The next one, I think, goes to Mr. Carr, our athletic director.
Okay, thank you, Leslie. Just wanted to update people on a couple things. We know that our co-curriculars are important and it's part of the whole child experience. So just wanted to give you a brief update on where things are, where we are in planning. So almost all of our co-curricular and clubs are being offered virtually through the district in all of our schools, elementary, intermediate, middle school, and high school. The only ones that aren't being offered right now are mostly service learning and in-person type learning clubs and activities. So they hope when we get back to school, they hope to start those. But a lot of our clubs, I would say over 90% of our clubs are being offered virtually at the time being. So the high school sports teams are starting to pilot social, emotional, and team building with a certified mental performance consultant. And they're working on things like connections with teammates, understanding emotions, self-talk, and controlling the controllables. Our coaches are also providing individual workouts for athletes to do. Students, We will be encouraging them to register online for this winter sports season when we will be able to offer that. We're planning to offer winter sports according to the WI guidelines if public health allows. And this situation, as everybody knows, is extremely fluid, and sports will look different this year than they have been in the past. So we are planning, we have plans in place, we have guidelines in place, and then we will follow those public health guidelines. And we're working with the Dane County ADs because we know the Dane County requirements are a little bit different than other requirements. As if you remember, the Badger Conference spans 7 different counties and all works with 7 different public health organizations. So we are going to meet next week as a Dane County group to talk about starting and continuing winter sports when we are allowed to do that. The Badger Conference is also meeting Wednesday, to discuss our winter sports and alternate fall planning. So we are doing a lot of planning. We just need to keep meeting metrics and getting the guidance from public health. And then we are also exploring the possibility of bringing in athletes in small pods for workouts when we have a little better guidance, but we're going to talk about that Wednesday too at our Badger Conference meeting.
Thank you, Mr. Carr. It's important to underscore how important co-curriculars in all of their forms are to our students. And so that's why we're continuing to push forward on finding ways to do things that will make a difference for them. Now I'd like to pass the next portion of the presentation, because it's very related, to Dr. Weidensee, who will talk a little bit about the supports that have been put in place for our virtual learning experience for mental health and social emotional learning. And so now I'm going to pass the baton to her.
Good evening, everybody. As a couple of people have mentioned already, there were some work groups in the summer, and I was a part of the social emotional learning mental health group, and that was actually a really exciting committee to be on. That group of people worked super hard and were super enthused about making sure that everything was as good as possible for the students when they came back. They worked a lot over the summer on preparing lessons for social emotional learning, for getting second step curriculum in place, for providing some presentations for parents to help support them as well. So it was a super exciting group. And one of the first things that we wanted to do is take a pulse on the students when we got back to school. So we sent out just a quick check-in to all families in September, and we had over 460 responses. And about a third of those asked for a contact either with the parent that replied or with the student in that family. So all of those requests have been followed up on. And as a result of that, we've had individual supports that have increased in the buildings. And we've also had an increase in group interventions based on the feedback that we had from those students and parents. Next slide, please. So this is I feel like it's a small list actually, as compared to what's happening in the buildings. But one of the things that is a major focus is universal SEL instruction across the district. So there's weekly lessons at all levels, and it's different at the elementary than it is at middle and high school, but it is social emotional learning across the board. Then there's some reinforcement of some things that happened last year. For example, zones of regulation is something that all K-4 students were taught last year. So the kindergarten students haven't had that. So the student services staff is teaching zones of regulation to the kindergartners and reinforcing zones for the 2nd through 4th grade. At each of the buildings, there is a focus on looking at who's engaged and who's not engaged in learning. And so the student services staff and the principals and the teachers are connecting on those kids, and they're making contacts home and problem solving, home visits, doing things like that if they need to. Virtual services have continued, and as Shannon mentioned, that doesn't work for everybody, but there is a lot of it happening. So for example, I'll just pull the middle school for an example. They have 42 students who are being seen virtually by the student services staff on a regular basis. And they have 131 other students who are being seen on an as-needed basis. So there's a lot of support happening among student services staff. And that's just one building. That's happening in each of the buildings where the counselors, psychs, social workers, social emotional learning coaches, everybody is involved in trying to make things as good as they can for the students. So one of the things that I heard our high school student mention is that they are providing some new student support at the high school. They're also doing that in other buildings. So while it might be student council led at the high school, at the other buildings, they are doing virtual meetings, they're doing lunch bunches, as they would if the kids were in person. They're doing some of those things just virtually to make sure that the new students to our district are feeling welcome and have some connections that they might not be getting just by being online. We have continued our PBIS instruction and supports across the board. Again, the counselors and psychs all have websites and virtual calming strategies available to students, and they've tried to make those known to parents as well. We continue to work with our outside providers. That includes some social work services from the county, but it also includes our Building Bridges social workers, Oregon Mental Health, Lake City Counseling, and some additional providers that have expressed interest in working with us that we can refer students and families to if we can't meet their needs at school. We're starting with the Hope Squad. The Hope Squad is a suicide prevention program, and that's a peer-to-peer support kind of a program. So there are 15 students currently being trained to be helpful to their peers in recognizing when students might be in distress or might be going through some emotional challenges, to be able to provide support to them, to make sure that mental health issues are open and being sort of normalized, because we know that we have over 30% of our kids in any given year who experience a lot of anxiety. So mental health needs are present regardless of our learning format. And then the OHS neighborhood model is something that I think is working quite well already. They are getting referrals from the teachers. And so the neighborhood model has the link between the counselor and the administration, and they are working together to follow up on all of the students that are at risk. So they've had, for example, 66 responses, 66 referrals to their teams, and they've been able to respond to already 55 of those. So it's something that's helping to provide some consistency in response. They've also been able to respond to over 250 students on their at-risk list at the high school. So there's a lot of things that are actually happening in the student services arena to try and address what we knew would be a challenging year this year for students. So you can go on to the next one, Leslie. So in addition to those kinds of things that I just touched on, they're also providing some group support to students. So some of them are need-based, some of them are skills-based. For example, they're doing some social thinking, teaching skills, they're working on social isolation and loneliness. They're trying to help kids improve their organization and executive functioning skills, and working on stress management and coping. We also recently did the CBITS screening, and that of course is at 6th grade and 10th grade. So we will have a lot of data from that to look at, and for those groups to be able to work on the intervention program. So normally the CBITS provides a 10-week intervention for just a small number of students who are experiencing trauma, who meet the criteria for trauma. But we also generally get a lot of information on what other kids need. And so they might have individual services after that, or they might have group work, or we might refer them out to one of our providers for additional help. This year, the CBITS screening has increased the questions. They are virtual this year as well, but they've increased their questions on their screening to include the major traumas that we see in society right now, which is COVID and the social injustices that have happened across the country. So there are those kinds of questions that are embedded into the screener this year to make sure that we are addressing whatever needs the students are experiencing. They're also doing a lot with restorative justice. So we have leaders on the student support team who are experts in restorative circles. And so they're working in their buildings on making sure that there are prompts for circles, there are opportunities for people to engage in circles, for community building, as well as for restorative work that might need to be done between students. They're working on forgiveness and anger management, girl empowerment, and then there are some affinity groups that are happening. And I think that we heard that from the high school students as well, that their multicultural student union is up and running. The Black Student Union is open to students, and there's a dancers affinity group. So there are some things that are doing just to make sure that kids are getting engaged and interested in things like yoga, like workout clubs, arts and crafts, just a variety of things that the student services group are participating in. They're leading, they're helping kids connect and get together on those things. So Shannon already mentioned that the Friends of the Oregon School District has the mentor program. We think that's an important piece of making sure that kids are staying connected as well and staying healthy. So I put that in there, 20 students that are continuing from last year, and I'm sure that that will be a growing area for this year. And then the last thing that I just wanted to mention, because Jim and Shannon both, and Leslie, all mentioned that people are working really hard, and it is kind of a high burnout for staff. It's hard for them to keep up all the formats that they have to teach in. One of the things that the Student Services Group got trained in and worked with teachers for the last couple of years is in compassion resilience. So they continue that work with our staff, but they're also this year opening up to the community through community ed. There will be some compassion resilience training for caregivers open to parents, because we know that it's hard for parents to work through all of this as well. And you need to be able to give yourself a break and take care of yourself as well, so that you can take care of your kids. That's true for teachers, it's true for parents. So that's an additional thing that the Student Services Group is doing. So that is sort of an overview of what's happening. There really is a lot of concern for mental health, and I appreciate that, and I know that our student services staff would too, but they're doing a lot of work to try to help do as much as they can. I think that's it for me.
Okay, thank you. Thank you, Candace. And now I just want to have one more slide before we open it up for questions. And as you see, I said additional information, and we put one slide in here on enrollment because we know that people have asked about it, and it certainly is something that the board is interested in. So based on our third Friday count from last year, we are down one student. And you can see that last year's open enrolled out, we are definitely up as far as the number of people open enrolling out. But we are also up in the number of people open enrolling in. So all of those factors coming together, we have one student less at third Friday count than we did last year. Now, for a growing district, I think it's kind of odd to have one student less. But in order to give some context for that, I wanted to point out that some of our neighboring districts, we know one is down 163, one is down 97, one is down 70. So in actuality, compared to some of our districts in the area, other districts, we're in better shape, perhaps, as far as not losing as many of our families. And as far as I'm concerned, losing one is too many. But I just wanted to give you the big picture as to where we are related to enrollment. So before we move on to the next item, which is the summer school presentation, I will stop presenting, and then we'll move into the question format.
Okay, and this will be question, comment, feedback time for the board. And then I'm going to start, Troy, for you, and then Tim, you're next, okay?
Okay, thank you everyone for that presentation. So I had, I think about 8 questions coming into tonight. Several of them have already been answered. But I guess I want to start by stating kind of where I stand with where we're at today, and because I think my questions are going to revolve around where I stand today. So at this moment, October 12th, 2020, with the data around us, what's going on around us, I fully support the decision by the administration to follow Dane County Health guidance. And I support our plan to move forward by bringing our youngest learners and those with special needs into the district first. And that's what I heard tonight, is I've heard that we're gonna continue to focus on building up from our youngest learners first, and also with a very, very high focus on those with special needs. That's where I stand. I believe that balances our young people's rights to an education with the need to protect the broader community from further transmission of this disease. And we have a responsibility in both regards. And we really need to maintain trust of this community that we're doing what's safe for our students and our community. And I look back on a statement, you know, that I read very early on as this disease was developing, and as people were trying to figure out plans for schools going forward. And the statement is that one step forward too fast is going to result in many steps backward for a long time. And I think about that a lot, because I think about how we are fortunate enough right now to have our K2s in person learning. And we know that's really, really important, that they need those skills in person, that they're just not able to get those skills online. And I'm fearful that if we move too fast, that we're going to put those K2s at risk. And that as we even bring on our three fives, you know, moving too fast is going to put those students at risk. And we need to hold that in high regard. And Dr. Bergstrom presented those challenges earlier with the substitute teachers and contact tracing and all of these things that just become more and more challenging as we bring more and more students on with the current situation, with this high rate of transmission in our community. I also just want to give you a peek into what I've been thinking about. You know, I take this very seriously. I'm an engineer in my day job. Since this pandemic has started, I've been tracking the numbers. I started out back on March 9th. I built my own spreadsheet, and I track the numbers every day. Every day I go in and I add to my spreadsheet. I've been able to add to it lately, where we can now look at the Oregon school district census area. It gives us a greater understanding of what's happening locally, and I'm watching the trends. You know, this is the first infectious disease I've ever tracked, I've ever studied. There's a lot of nuance of data. I know that there's a lot out there, and I'm reading it all and I'm considering it all. But right now, what stands out to me is that Wisconsin is the 3rd highest state for positive test rates. The current trend in Dane County is actually looking good. We're decreasing, and I think that's great. But we also have to be aware that other parts of the state are not, that they're increasing. I think we really need to be looking at the relative risk to the community to determine when it's appropriate to bring the kids back. One of the things I've been watching really closely is the rate of hospitalizations in Dane County. It's at an all-time high. The ICU patient count last week was at the highest it's been since April. We've seen that drop a little bit. But I look at our community of Oregon, and I look at the hospitals that our community depends on are in Madison. And those Madison hospitals they have a high patient count. And I also think about our kids who, you know, we talk a lot, we've heard a lot about the mortality rate, the fatality rate, and we know that that's low for our students. Anyone under 18, anyone under 40, it's very, very low. I recognize that, but we can't lose sight of that this disease does affect people, and it does hospitalize people. And when our students have to, you know, they're having a hard time with virtual learning right now, but they're going to have a really hard time with their parents being hospitalized potentially from the disease. So that's kind of where I stand today. You know, I'm optimistic that this case trend is going to continue to decrease, and you know, it's possible that within a month we're gonna hit that 39 number. I know that the metrics are going to require us to sustain that for 4 weeks, and I guess that's where I get a little bit. I'm trying to predict the future and how this is going to look, and I look at a potential situation where we're hovering around that 39 number or 19 number, whatever it is we're using, and we're bouncing around above and below, and we're not sustaining that 4 week requirement. And that's where I think I would put some pause as to whether or not we want to or need to, you know, be adhering to those metrics. And you know, like I said, those are my thoughts as of today, October 12th. It's not a slam dunk that it's ever going to be safe. I think we're doing an incredible job of keeping our students safe. I encourage out of the box thinking and innovation, and you know, considering other ways we can do this. I also want to state that, you know, there's an awful lot of community members who really want to help, and whatever we can do to bring those community members in some way to assist. You know, I know there's a lot of people that are willing and ready to help us out. So with that, I guess the question that I have really revolves around the choice question. Can we provide a choice? And I guess what I heard from the K-5 presentation is that we could go back to school pretty much immediately for K-5. I'm not sure that I gathered that from the middle school and the high school. So I guess let's start with that question: is how quickly could we go back for those upper grade levels?
Okay, guys, who wants to do that one? I can start, and then Jim and Shannon can definitely chime in, because we've discussed this quite a bit. And as the numbers continue to decline, as we all hope that they will, I think that will give us lots of lead time to be preparing, so that when we meet or we come close to the metric, we don't need weeks to be ready. So Jim and Shannon, I know we've discussed this a lot. What do you want to add?
Yeah, nothing in particular other than, yes, we're preparing, and when we see that it is feasible for us to return, we're going to continue to kind of ramp up everything that is associated with us getting our kids and our staff back to school as quickly as practical and possible. In addition, we're looking at ways in which, when we come back in this model and we are able to show success, maybe in the middle of a grading term, ways in which we can expand it at a natural grading term by doing things like potentially creating standalone virtual sections on teacher schedule where that's possible, where I have high section count courses, and we can incorporate some of those things and grow our day as we're showing more and more success with being back in school, staying in school, and continuing to be coherent instructionally for our students.
I think in addition to what Jim said, I think when we get closer to actually having a date, I think we will provide our teachers with some time to just get spaces physically safe and set up, because we don't have kids in the building right now. And so the K2s did that in August. And so our teachers would need a little bit of time, a couple days or something to make that shift and to make sure their spaces are safe for our kids.
Okay, thank you. And so my next question is, it really, I guess, revolves around the flipped model that we learned about tonight. And I guess I'm wondering if we, and in reflecting on the letters that we heard tonight, and there's this kind of a split out there in the community that some people want to go faster, some people maybe want to go slower and they're not really comfortable with where things are at, where things are moving. And I expect that sentiment is going to continue. So I guess my question is in providing a third choice, and if we were to open it up, what's the sacrifice to the Oregon online students, or potentially students who signed up for phase-in, but they're going to switch to Oregon Online, or would have to switch to Oregon Online because they're not comfortable? What is the sacrifice to those Oregon Online students, or is there a sacrifice?
So Troy, if I can jump in to ask a clarifying question, are you saying that we would, if hypothetically there were a choice and we were to say we're going to create a school within a school, right? Is what you're, I think, talking about here, where you would say we're going to create an all in-person option for those that might choose that option. Is that what you're asking?
Well, sort of, but I guess I'm not. I'm asking the question and revolving around the flipped model, because I guess the flipped model is what we've chosen, and that's what we're going to run with. So how would that work if that were implemented 6 weeks from now?
How would our students would continue to have a portion of their day where they would engage in distance learning around the delivery of new content, and they would apply that learning in person in our classrooms under our teachers' guidance and direction. And so where students are struggling, they get support. Where students are excelling, they may get extensions. Where they are reading and absorbing, they come together for discussion. And that is kind of the principle basically behind the flipped model. I think that the inherent challenges that, Shannon and I talked a little bit about delivering content in a mask in two different environments at one time is incredibly challenging. And so I think we're looking at a way to maximize the leverage of of what we've learned in terms of the online delivery system, and utilize our staff in an intelligent way to support students in their learning and their social emotional wellness. That's the key.
So I guess let me maybe ask us in a little different way, Jim. How critical are the numbers of students that are in Oregon Online versus phase-in with the flipped model?
In the way that we are right now, the way that we have this structured, it is very fluid. We could be very flexible. If you told me that you wanted me to build a school within a school right now, and it was going to be 200 students or 250 students, there's a lot of logistics and complexity to that, depending on who they are and what their schedules look like. I could peel off English teachers easier because of their certification than I could science because of their specialized certifications. It would create some logistical challenges that we would grapple with. It wouldn't be undoable, but it wouldn't be doable in the middle of a grading term, and I would need some run up to it. If I had we built a block schedule for the building, and it took us 3 weeks to reschedule everything. If you could tell me we were going to start at semester and I could get several weeks run up, I could do the best that I could, but I can tell you that I could do that in biology where I have multiple sections. And when I have Calc BC and I've got one section, I could not create a standalone section for virtual students. We would have to problem solve around a live stream or recording lessons live, and then our online kids absorbing that asynchronously. So there's a lot of complexity. I don't want to get too deep into it unless you want to take me there.
No, and I apologize. I didn't ask that question very well, but you answered. You covered kind of what I was trying to get at. So, I guess one more last question here. I think everything else has been covered, but revolving around contact tracing, and you mentioned, Dr. Bergstrom, that we're really maxed out at times with doing that, and we're learning as we go here. But Are you, I mean, are you thinking that we're going to be able to accommodate that with our current staffing? Are we going to need to shuffle some responsibilities as this goes forward and we bring on more students? Or what are your thoughts on that?
Yes. Gina and I spoke about that this morning, is that the more grades that we add, the greater responsibility there is for contact tracing when there are positive cases. And so to add in more grades, we've already discussed potential responsibility shuffles. And, we'd have to see what it was like once we added in 3 5s. Would we need additional help to do the 6 12s? It's possible. Do you want to add anything to that, Gina? I know this is Gina. We are learning as we go, but I would say Gina has done the learning ahead of time so that she's very skilled in answering people's questions. And this is something that we have to be on point with all the time. And that's why it's been given to Gina as a job duty, because that is something that she's really good at. So do you want to add anything to that, Gina?
No, thank you though.
Okay, and that's all I had. I'll yield to Tim.
Yep, thanks, Troy. Tim, you're up. Heather, you're next.
All right, very good. Thank you, Troy. First, I just think that the administrators and everyone has done a tremendous job getting prepared. I know that there's some concern about in the community about the continuing of the preparation process. The sense was that we were working over the summer to be prepared, and there still seems to be some discussion around getting prepared. And Jim, you just mentioned it, for instance, that you would need some time to prepare to bring kids back into school. I think you've done a great job preparing. I think you've gotten technology out to kids who need it, additional MiFi support if they're challenged by internet service. I think that you've developed protocols, questionnaires and testing if people are feeling ill, requirements to stay home and quarantine if that's the case. It sounds like preparing for someone to be ill is in place as well, and within the mentoring program. And they're really struggling. Their family is struggling. They've got 4 kids who are really disconnecting from school, and I'm really concerned about that. And I feel badly for them. And so they need, at least the young man that I work with needs more structure badly. He's got idle hands, and it's hard to keep him focused on his schoolwork. He's been very clear that he's attending all of his classes. I asked him today if he could show me a class that he wasn't able to attend, and if he could show me what it looks like. He said, "Oh, I don't have any of those classes on my Chromebook because I attend every class. I just don't do the homework." And that's concerning to me. If my son told me that, I would be very concerned. I was not a great kid in school to begin with, but having teachers kind of hold my nose to the grindstone was really, really important for me. And so I can appreciate where he's coming from. In terms of, we're hoping, and I don't want to get into a political discussion, but we're hoping that we have a vaccine coming, which, can help us conquer this COVID issue, hopefully. Do we, Dr. Bergstrom, do we have an expectation of when a vaccine is available that might help us get back into a regular face-to-face situation more quickly? Do we have an expectation in place today?
Do you mean regarding the fact that once it's available, an expectation for people to have it before they're back in, something along that line?
Yes.
No, we haven't. That's the type of guidance we'd probably once again look to public health for. But honestly, I don't think we need a vaccine to be back to school. All we need is a lower community transmission. And once that happens, then I think that we will be in a much better place. Right now, the numbers are just much higher than anybody would want them to be.
And I think that's true in Dane County. I absolutely believe that to be true in Dane County, but I like to think that it's different in the outlying communities. And I'm seeing some of the outlying communities, certainly outside of our county, sees that as well. Troy, you mentioned, for instance, that you have Oregon census data. So you're able to, it sounds like you're able to hone in a little bit better on transmission rates in our district, in our village. I'm not exactly sure what data you have available. Can you reflect on the data that you've been tracking? It's more specific to our situation and less specific to Dane County situation.
Yeah, so it's available on the, I believe it's the Dane County Health website, but you can click on the various census areas. And I mean, what I'm seeing is that it's our school district census area, including Oregon and Fitchburg. And you have to be a little careful because those census areas don't line up exactly with the school district boundaries, but it's tracking pretty closely to Dane County from what I see. So, and Dane County is lower than some other parts of the state right now. So,
and I think we can all agree that the influx of the UW population certainly skewed those numbers. And the UW population does not find its way to Oregon, Wisconsin. It just doesn't. And so I am concerned that if we continue to use Dane County numbers, we won't be in school this year the way people think we will be. And so I am a little more anxious. I am, for a whole variety of reasons, mental health being a biggie to me. I am more anxious. And so I can appreciate those families that are struggling to keep their kids focused on, their online learning and getting their homework done, and then the idle time they have outside of their morning classes. And so I can really appreciate their perspective. And so I'm anxious. I'm more anxious than most in getting kids back to school. One last question regarding this community-based medical and mental health task force. Have we considered that any further? There are communities like Wanakee that have that in place, and they're a little bit ahead of us getting kids back to school. Are we considering doing that both from a medical as well as a mental health and social worker perspective?
Yeah, so Candace and I are meeting with one of our community members who works for the Meriter Adolescent Psychiatry Unit. So we're always looking for people who can take a look at our plans and tell us where the missing pieces might be. Always looking for outreach in that manner. I have reached out to Wanakee Superintendent Randy Gutenberg to talk about his medical advisory committee. And what's very interesting is that from how I understand it is the board makes a recommendation and the medical advisory committee tells them whether or not that recommendation is safe.
Okay.
So it's not as if the recommendation is coming from the medical advisory committee.
And how do you feel about that?
Well, we've had very strong messaging to our staff and to our community that we are following the experts who are on the board for public health. So I would have to really give a lot of thought as to whether or not we as a district should be going back on what we told the community we were doing. Because for instance, and this is something that I'm very interested in learning more about from Mr. Gutenberg, if indeed Wanakee decides to bring grades 3 and 4 in before the public health indicators, that is not a done decision. It's something the board would like advice from the medical advisory board about. Mm-hmm. But if indeed that happens, I'm curious, does that mean that their public health really isn't one of the guidelines they're following anymore? What type of consequences might they see in the rest of the community? What would their staff think? I'm really curious. So I want to learn more. And I know that I believe there's at least another school district who's considering it. Otherwise, most school districts just have an advisor, not an entire committee, because they're really focusing in on the metrics from public health.
I just think keeping mental health and the social emotional piece clearly in the game is part of that balance. It is part of that balance. Health is super important, but mental health and social emotional health are equally as important. And I think if we just focus on the health piece, we could lose some of that balance. So that's all the questions. I just really appreciate all the work that's happening behind the scenes. I want people to know where I stand, because I'm pretty clear about where I am clear about where I stand. So thank you.
And Heather, you're up, and Anna, you're next.
Great. First of all, I just want to echo Tim's comments on the gratitude for the administration and the staff and the teachers. The time and effort that you all have put in is above and beyond and absolutely amazing. I'll follow Troy's lead and Tim and briefly talk about where I stand, and then I have a few questions, although a number of them were answered tonight. So thank you for that, for those who presented. I do support the plan as of today. I think if Wisconsin were not in such rough shape, I would have more questions than I do now, but I'm willing to wait, to hopefully see that decline continue, and hopefully then the question of the case count gets answered for us. Like everybody else, I want kids in school, and I know that that's important, but there is risk associated with that. I do have some concerns just about, I think Troy mentioned it kind of in that 4-week requirement piece, or, if we're consistently at 40, well, 40 is not 39, what are the gray areas around that? Obviously there's no perfect answer. So I fully understand that. And I think while everybody is working incredibly hard, I would like to see some sort of structural community task force, or, whether it's similar to the Waunakee Medical Board, or whether it's something where people who are experts and professionals can come at this together. If nothing else, then to, I am not an engineer, and so I am not running the numbers like Troy is, but I think just it would be really helpful to the community, as well as to the board, to just have that collective data and summary, and whether or not it's opposing, or agreeing statements. I just would like to see some sort of multiple person approach to that. In the meantime, what I'm really focused on is what can we do right now? And because, this is not going away tomorrow. And so I think about I think it was called the hub learning. I'll get to my questions in a second, but I think about the mental health piece and what can we do now, right? Because that's the trend and the theme of the night. And that's not to say we aren't doing things. I was impressed to see all that we are doing, but I still worry about those that either aren't filling out the survey, or, we aren't hearing from, or need more than we can do for them virtually. So, and then I think the other takeaway is, can we continue to review this, to say, yes, I think we do have a responsibility to people. We said we were following the Dane County public health metrics, but I think for how long? I think, and this is just an example, are we able to say this is through first semester, or this is, through X date? That way people have a clear understanding that at a future point, this may not be the case, right? If that's a decision, not advocating that should be the decision. So those are my two takeaways: is what can we do now on the mental health piece, and how can we continue to review and be really transparent about a potential fork in the road from how we're currently approaching things. So my questions are, the hub, if this was answered, I don't think it was, but I apologize. The frequency of that, is that a daily thing for these 10% of the students? And what is kind of do we have an ability to expand this within the parameters of Dane County Health? And if so, what's limiting this expansion so that we might be able to reach more students?
I talked, just as an example, at the middle school level. I mean, a student who needs internet access is probably going to be a student who would come for 4 days, right?
Right.
But another student who maybe just needs kind of like to come in once a week and meet with a counselor and just kind of do that like check-in touch point. In full transparency, I right now have one staff member open in the morning who could help supervise this, because in the morning everybody's teaching, and so for us there are some parameters staffing, and we're trying to be super creative with what we have. And so, and then of course we have a lot of, I'd say about well over half of our staff is in the building delivering instruction. And so the cafeteria is an open space, it's a large space. I don't anticipate us bringing in 10%, and we're 640. So I don't envision bringing 64 kids in for a week. That would be beyond our capacity, but maybe over the course of a week, we'd have some different kids coming in. But it's going to be really personalized. Our mentors meet with the kids once a week. So that would be just a one-touch, but it'll really vary on need, but we do have some staff parameters.
Yep. Okay, and thank you. And then do we feel like, I realize this is pretty new and we'll be learning more as we go, but do we feel like the students that we are either serving now or will continue to serve will be enough, or will the need, I realize there's a desire to go to school, right? But there's a difference between the desire and the need. Will the need be served by this, or are there other options that we can look into to continue to make sure that, you know, internet connectivity and mental health are at the forefront?
So the big question is, can it be expanded?
Can it be expanded, and is there a need for expansion, right? Because this is the most kind of severe case of these students, right? Obviously there's a desire and a will and a want to go to school, but there's, you know, internet connectivity and mental health supervision is a need. So I guess I'm just curious, do we think that this initial hub program will cover those greatest cases, or will there still be increased demand beyond what we can cover?
Well, it depends. It depends, I suppose, on how students react over the course of time. I mean,
Right.
I'm still hoping that our students are back with us far prior to second semester, and then we really, we'd be in a whole different situation.
Sure.
If this extends, because as a community, as a broader community, we're not able to get the numbers to a safe place, then yes, I think we're going to have to dig even deeper in the creativity toolbox and find a way to bring in more students in that supervised way. But for now, I think 10% over the course of a week is a really good goal, and we certainly can go over that, and we may go under that. It depends on the needs of the kids who are presenting.
Got it. Thank you. And then in terms of the well-being checks, I think I heard that there's another survey going out, but I guess my concern, as always, is what if people aren't replying? And I realize that we can't, force somebody to reply, but I think even, I think the initial thing to even reply was your email address. And so I guess, is there a confidential way? Are there other routes that we can go so that people can, less formally or less with fewer barriers get this help or reach out and say the need that they have?
Right.
I think one of the things that's happening is people are seeing some of that need by virtue of lack of engagement. So that all of the teams across the district are looking at that, and they're reaching out and connecting with people and trying to problem solve if they see that kids aren't connecting. And that is really a lot of their contacts. So I think that they can get to people that way. They all have websites, they all have web addresses that any of the kids can email. A lot of the counselors will send out a well check email to the students themselves so that the student can then ask for help. What's your mood, that kind of a social emotional check-in kind of a thing. And then do you want to have a counselor connect with you? So a lot of them have that in place also. So if the kids can respond, they could certainly do that anonymously.
But this is all virtual, correct? There's not an in-person option for well-being checks. Is that right?
No, that there are students who are coming in for in-person services.
Okay.
And there are home visits. When we're really
Okay.
concerned, we're going to the house.
Okay, I just wanted to clarify that. And then I guess the only other question I had on that was, I think somebody spoke to the number of referrals. I just was curious if, in trying to be apples to apples, right, in similar programs that we referred out last year, perhaps that would be a good indicator of the increase of the number of referrals this year versus last year.
It is a
Anybody-
good one. And Shannon has the answer to that, I think, because she's,
Okay.
yeah.
While I don't have the exact numbers, I would say that when we look district-wide, the middle school numbers are traditionally the highest. And so when I got those numbers from our student services team, I wasn't surprised at all. Like, our numbers are always really high. And so I think we're like around 20 to 25% of our have had some touch with a counselor for a whole host of different reasons, but they're kind of in line with what we've seen in the past.
Okay.
It's a tough age.
And I'm
Yep,
sorry
yep,
that I
and
didn't give you
I'm-
that
I'm-
information.
Right, I'm not, so, I mean, yes, that is a high number. I was more curious about the change from, last year to this year or something like that. The other question I had was, I think we're getting the families and teachers will be getting a new round of surveys, just a general survey. Is that right, Leslie? Do you have a timeline for that?
This week for the families, for sure. But we
Okay.
spent a lot of time talking about the family one, so the teacher one might have to wait till the week after that.
Okay, but there will be a teacher survey and that data will be reported out, right?
Mhm.
And then on that note, this kind of ties in with the enrollment numbers and the survey, I guess, specifically for 7 through 12. Jim, I think you shared that there's flexibility, but if we see either way, right, a drastic change, because the last time we took a survey was July and things were different in July than they are right now. How does that affect the plan for the flipped model?
It really doesn't, as long as we can maintain distancing in our classroom. Most of our classrooms are scheduled somewhere between 25 and 30 full capacity. And, our best estimates right now are that we're looking at a small number in each classroom that would maintain in a virtual setting. Let's say nobody was going to stay virtual and they're all coming back. We have mapped out our desks in our classrooms, and most classrooms can handle close to 15 desks, distanced appropriately.
Got it. That's a helpful number to know. And then Leslie, I guess on that note, do you have numbers? And if not, could you get them for perhaps next time? The switch thus far, have we had, I'm making this up, 10 families go online and, 10 families come, what is the kind of the change in those numbers for right now?
Absolutely, we keep a spreadsheet on that. So we saw a lot of changes when we were bringing in K2s. A lot of families switched to Oregon Online, and then interestingly, a lot of families switched from online to phased restart. So it ended up being somewhat even, but we keep a spreadsheet on that and can absolutely give that information.
Okay. I think that does it for me. Thanks, everybody.
Thanks, Heather. Anna, and then Kevin, you're after Anna.
Thank you, Steve. I guess I want to start by saying I empathize with every family that is struggling with this virtual learning environment. I've read the emails, I've heard the stories, and I've talked with friends who are sharing their experiences that are not necessarily positive. And it is heartbreaking. It is absolutely heartbreaking. It's difficult to listen to those stories and not feel like I have a solution that can make it different or make it better for their child. I also empathize with every family that has been impacted by this pandemic, whether it's from losing a loved one, losing a job, or to the feelings of social isolation or depression that are certainly present throughout our community. This is not easy for anyone. Obviously, we understand that virtual learning is not working for everyone, and it's important for our district to be aware of those issues and those concerns. It's also important for us to know what is working. It's important to get feedback on both the positive and the negative sides so we can continuously improve upon that. I want to say, based on tonight's presentation, I am so pleased to hear about the interim plans to bring some of our high-risk students into school with the Learning Hub. That is wonderful. That's a wonderful report to have. I'm so happy about that. I'm also really pleased about all of the work that's being done from the social emotional learning side of things and the mental health side of things. This district is top notch. And I will say that today, I will say that any day. This district is top notch, and we are getting the highest quality people working with our kids every day. One of the things I guess that I will continue with is to mention, I guess, describe where I stand on the issues of the phased restart plan. I support the plan that our administrative team has put together by offering the two choices of an online option and a phased restart option. And I guess I'd like to give some reasons for that. The primary reason for that is that I believe strongly in following experts. And in this situation, we're talking about kind of two different experts that we are listening to and taking advice from and making decisions from. Those are the health experts, and those are our educational experts, our educational professionals. And the way I'll spin this is, like Troy, I'm an engineer. And so I'd like to give an example of how I do my job related to being a technical expert and how this plays into where I stand on this issue. I'm a senior engineer for the city of Janesville. I'm a registered professional engineer in the state of Wisconsin, and I have an emphasis on traffic and transportation engineering. I'm not a health expert. I'm not an educational expert, but here I sit on the school board representing education and safety of our students during a pandemic. So in my line of work, I deal with a lot of controversial issues, most notably traffic safety at intersections. I get contacted regularly from residents who feel that the intersection should have a stop sign or a traffic signal installed because they feel it is unsafe. It's my job to collect data, including crash history, traffic volumes, sight distance, pedestrian volumes. I'm looking at the context of that intersection. I'm collecting data, and then I prepare an engineering study with a recommendation for whether a traffic control change should be implemented at that intersection. My recommendation is rooted in public safety. It is my job, I have an ethical code, to provide a recommendation that provides for the safest way to operate that intersection for the traveling public. The expectation is not for the individual who requested that stop sign to suddenly become an expert on traffic or transportation engineering, or to perform their own study of the intersection. I am hired by the city to be a professional expert and to provide input on something that I have technical knowledge in. I'm certified, I'm trained, I have years of experience, and I'm trusted within our community to make those difficult decisions. So I feel pretty strongly that we should be making this decision by following the recommendations of the experts that we rely upon in health and in education. I do not think that we should be making a decision based on the number of people who want to have an in-person choice. I understand there are challenges, and I think we need to understand how to solve those. But I do not think that we should make a decision because of the demands that are being placed by the number of people who are demanding it. I feel like we should follow public health, and I feel like we should follow the strength of our administrative team to make a good decision about when it's safe to bring our kids back into school in a way that is safe. I do have a couple of questions, I guess, related to the presentation. The first of which is for that Learning Hub interim plan for bringing kids back in. Is there transportation available for that, or is that only relied on for parents to drop kids off?
It does work, the time frame with transportation, so it also wouldn't overlap with the elementary routes.
Awesome. Great. Second question is related to, and this is kind of for Candace. You'd mentioned that you're identifying student engagement and reaching out to kids. How are you identifying that student engagement? Is it just based on kids who are not signing in? Is it kids who are signing in but are not actively participating or not being visible on the screen? You know, I imagine some kids maybe don't want to be on the video, or they do, or so I'm just trying to assess how you're identifying that at this point in time.
Yes, I think both of those things that you said, I think there's a lot of teacher identification. They're not engaging, they're not completing work, they're not coming at all, you know, to the classes, or maybe they'll pop in and then they'll leave. That kind of thing I think is happening across the board, and those are people that are being followed up on.
Okay. Third question related to the flipped model that we learned about tonight. It sounds really interesting, and I think I would support the fact that that's the preferred method of a hybrid model for our 7th through 12th graders. With that said, I guess, do we know the response from teachers regarding the additional workload? Have they been engaged in this evaluation or this recommendation? Are they on board with this? Are they aware of it? And is there going, I guess I just want to make sure that that piece of the puzzle, because that's the one major issue associated with that model.
Jim and Shannon, go right ahead.
Yep. So the first focus on flipped instruction as a preferred model for hybrid came out of August's recommendations from the academic planning team. This fall, we worked extremely hard on getting virtual learning up and going, and in many respects, they're quite similar, other than the fact that the in-person support for students kind of takes that synchronous lesson out of the mix, and that synchronous lesson is replaced by being in person with folks. So it's a different workflow. Our teachers are already kind of buried, you know, they're in the red zone right now.
I know.
And so it is our job to be certain that we create manageable workflows. And in this plan, that is why we've got some flex in the afternoon as well, because, you know, we could go bell to bell, you know, bus drop off to bus pickup. But there's a point of diminishing return when you don't have adequate planning support time for teachers to develop curriculum, to produce it, and then to provide feedback on formative assessment. And so we're helping kind of redefine some of those workloads. I have worked with kind of my teacher leadership crew to vet, you know, the latest iteration of where we sit. And, you know, it takes a while for people to sink in and to begin to think about ways in which that alters their day-to-day reality. And I think the benefit is in person with kids, it does not create the ideal for any of our staff that they're going to punch the clock at 4 o'clock and zip out of here, because that has been anything but the case for our staff.
Thank you. That kind of covers my questions, and you know, a couple of things I guess I'll leave with is that you know, I mentioned that right now I do support our current plan, and I think it should be rooted in the experts that can guide these decisions. What I think our district should be doing right now is focusing on the following efforts. And I'm hearing this through this presentation, but listening to the input and feedback from our students, families, and our OSD staff on the challenges associated with virtual learning. We need to continue to have a pulse on that. I think doing a survey to gauge mental health wellness is very important. I think that's going to be a really good another opportunity to understand where our students sit across the board, and I hope that we get really good participation in that. I think we should be focused on continuously improving the virtual learning where and when we can, based on that input and that feedback. And we're seeing the results of that with some of the things that you have presented tonight. I think we should be providing additional supports to students and families in need from an equity standpoint. That would be those who have a lack of access to resources, a lack of access to the internet, mental health support, IEP support, all of the things that we've heard about that our district is actively doing. So that is so important and critical in maintaining a high quality education for all students. I think we need to continue to focus on developing creative ways to offset some of the challenges of virtual learning while still following the guidelines of public health, Madison and Dane County. And again, I see results of that from our great presentation tonight and the administrators that are sharing with us the great work that's being done behind the scenes that we don't all know about. I think we need to focus on supporting the mental health of our teachers and staff who are working tirelessly to provide the highest quality education they can. And I'm sure they are getting emails from parents whose kids are struggling, who are dealing with, dropped calls. And, I can't imagine the amount of emails they are managing on top of dealing with their own family situation and this virtual learning platform. So that is so critical. I think we need to continue our planning efforts towards an in-person or blended learning model in a way that does not diminish the quality of the virtual learning. And I think we've heard that from the flipped model. That was a critical piece for me. I wanted to make sure that we are offering that same quality, high quality education, regardless of the method that it is presented. And then lastly, I want to ensure that our planning efforts for an in-person or hybrid model do not further overwhelm our teachers and staff. And that is something that is of high priority. We cannot expect to have a strong connection with our students if our own teachers are dealing with mental health issues themselves. We need them to be strong and supportive. I also think that we as parents and members of this community can play a role. And we as parents and community members should be focused on the following things. We should be providing as much community support as we can, whether it's through donations, volunteering our time, or reaching out to support our neighbors or families who we know are struggling. We should get our kids and families outside and be active. We know the importance that plays on mental health, social emotional learning. I think we as parents and families and community members need to prioritize that and focus on that. I think we as a community and as parents should plan small, socially distant outdoor gatherings with close friends. That may change when winter comes, but I think there are ways that we can be socially interactive outside of our school environment. There are things that we can do that we can help our own families and the families around us. I've seen neighborhood kids outside all summer and all fall, riding bikes, skateboarding, playing in backyards. We're finding creative ways for our kids to continue to be socially engaged. And I think that's important. That's part of our job as parents and community members. I think we need to be a cheerleader and a source of optimism, patience, and comfort for our children and our teachers and the administrative team. We need to demonstrate flexibility, adaptability, and resiliency in the face of these obstacles. We need to lead with grace and kindness. We will get through this, and we will be better at the end of this. And those are my comments.
Thanks, Anna. Kevin, before you wander in, we have a board policy 180 that says our meetings end at 10 o'clock unless extended by unanimous approval of the board. And so I need to know if anybody objects to continuing the conversation that we're in right now beyond 10 o'clock. My thought is that we just defer the summer school report and the other report, Leslie, but let's finish this one up. But any board member has a right to say we're done at 10. Does anybody object to moving beyond 10 o'clock?
No objection.
Yeah. Okay, good. Kevin, you're up.
All right, I will be succinct. It is 4 minutes away from my bedtime, so I might turn into a Hey, I want to start with, first of all, applauding the teachers, the administrators. I know how hard they're working. 3 of my sisters are in education. One of them's a principal of a private school in the Milwaukee area, and I know what she's been going through since really last March. So certainly applauding all the activity. I know teachers and administrators are working harder than ever in unprecedented times. I want to applaud the creativity I'm seeing and the perseverance I'm seeing from some of the teachers, and to share a light moment from this morning. My conference call around 8:30 was interrupted by my 2 fifth-grade twin boys making very loud animal noises. That's how they were asked to greet their class. So that was shout out to Miss Hoppy for her creativity and being a great teacher. So heartfelt moment there. So look, tonight we got more clarity than ever on the how and the what behind what the future is looking like, depending on how the health of the county looks. So I certainly appreciate that. I really like the flip model. It's really innovative. It's taken a lot of time and thought. It's obviously taken a lot of input from many of the school districts that have been doing this for, doing more maybe in-person teaching than we have been for the last, however many weeks school has been in session. My biggest issue continues to be the when and where we're getting our advice. And I've been very clear on this position from day one, and I'll continue to be clear on it, that my challenge is that we're only listening to Dane County. And luckily, it's so late in the evening. I work for a Danish company, so they're all sleeping right now, but I will say I spend 6 hours of my day today rereading all the emails we've been sent by the community, reading the new ones that came in today, and I certainly appreciate all the feedback. We have been reading them, we have been taking under consideration. As Steve said earlier, Leslie's been doing a good job of responding, acknowledging that we are reading every email. But part of my day too was spent reading the reopening guidelines for Dane County, because I'd heard a lot about them, I made assumptions about them, and I wanted to read every part of it word for word. And what's a couple things ironic, and I think it was mentioned in one of the parents' letters, is that the metrics for K through 2 are not even being met right now, but instruction carries on. The second thing, when I look at grades 6 through 12 and see how 19 cases per day was calculated, and how they came about this, I really lose a lot of optimism for us being back in school anytime this school year, not just this calendar year. Because I looked at every day, I'm not doing my own spreadsheet, Troy, so I'm not overachieving from that respect. I'm relying on the historical data that's online here from the Wisconsin Department of Health Services. And since June 15th, so 19 cases per day equates to 3.57 cases per 100,000 residents per day. We have to do that for 4 weeks straight, okay? So since June 15th, we have had 7 total days below 19. 7 total days since June 15th, okay? And 4 of those 7 fell between June 15th and June 19th. That's a pretty hopeless situation from my perspective. And I have a hard time understanding why Dane County is smarter than a big majority of our country that has got kids back to school. I have 14 nieces and nephews. All of them are back in school. They're in the Waukesha, Milwaukee area. They're all doing well. They're all taking the precautions we'd be taking, wearing masks, washing hands constantly, social distancing, half virtual, half in person. I just can't accept that Dane County is smarter than much of the rest of the country. And if that's the only metrics, building on what Tim was talking about, if that's the only metric, I love the how, I love the what, but if that's the only metric we're going to look at for the when, then we might as well pack it in for the school year, because it is almost impossible to achieve if that's the only metric we're going to look at. my opinion. So that's what's really disheartening about this whole situation. I believe people should have choice. I believe that people that are that want to stay virtual and have very valid reasons, I'm sure, to be virtual the whole year need to respect those that want to have a choice. And I think we should be given a choice to go back to school in some form sooner instead of later. And I'll use the word Tim used of anxious. I would call myself very anxious because I see what's happening from an equity standpoint. We talk constantly about equity, and I cherish that, and we all cherish that. It's so important. But the equity gap only continues to expand, period. We all know that. Nobody can deny that. So those that are suffering more than ever. And I have a real problem with that. And what I'm afraid that's going to happen is we may have only lost one student so far. And by the way, we don't have any private schools within the boundaries of the Oregon School District. So it makes it really hard, not really hard, makes it harder to move to a private school. I'm really sad. I'm really afraid that multiple people will be voting with their feet if something doesn't change sooner instead of later. And if we only are going to rely on Dane County, I think we're doing a disservice to our community. We're doing a disservice to our students. And I can't be any more clear about where I stand and why I think we can do this safely, because it's being done in many parts of the country safely. And I'll share one more example before I'll yield, because I know it's late. I have, like I said, 3 sisters that are involved in education. One of my sisters leads a foundation out in Boise, Idaho, that has been and continues to be a hotspot. She leads this foundation at a Jesuit school, over 1,000 kids, co-ed, and they've had 30% of their kids virtual all year, and 70% that have been in person 5 days a week with masks, social distancing, and all the requirements. And they told the 30% of the students that started out virtual that you must stay virtual the whole semester. And they've already been in school since early August. 4 or 5 weeks into the school year, they begged the virtual students to come back to school because they saw such a huge gap between the kids that were virtual and were expected to stay virtual the whole semester versus the kids that were in school. And maybe they were using Flipped, and maybe they were using the best types of training. Maybe they were doing, it's hard, I get it, trying to do, the virtual thing at the same time in person. But there is technology, it's being used at many high schools. I've seen it, I've asked. I just really have an issue that all we're doing is listening to Dane County. Dane County cannot be smarter than the rest of the country, period. That's my opinion, and I appreciate you listening. Many of the questions that I had have already been answered. I want to know when a survey will be sent. That sounds like this week. I think it's going to be very interesting, the results of the survey. I wanted to understand quickly about the flip model, because I really do love it in theory. But if we are able to provide choice to some and disconnect, if you will, virtual from in person, can that model be unwoven? Can it be separated in essence? I don't know if I'm asking the question properly, but Jim, hopefully understand and can interpret my question.
Kevin, I think you're asking if we can progress to a point in time where, I believe it was your sister's school that has 2 clear options, right?
Right.
All in person and all virtual. That would be easier to do than to kind of have 3 cohorts where you are trying to juggle a hybrid and a virtual. So if metrics ever got to that point where we were able to have the capacity in our building for 75% or more in attendance, 2 models would be easier to juggle than the hybrid and virtual. And logistically, we could figure out how to get there.
Okay. I just was wondering if it's an all or nothing situation, so. Jim, I think you're a little delayed because you keep talking and I can't hear you, so I think you've got your point across and maybe your video is not live with your voice, but that's all I have.
Okay.
Okay.
Thanks, Kevin. Krista, you're up.
Thanks, Steve. I'm going to focus on what we all have in common for a second. I think this community is not in different places all the time. I think one of the big issues out there was people didn't have information about the plan. So I want to make sure that we are all in agreement tonight about a really good thing that happened tonight. We have a plan of what K2 looks like phased in, what 3.5 looks like phased in, what 6 looks like phased in, and what 7.12 looks like phased in. So everyone in this community, if they say we don't have a plan, that's not accurate. We have a plan. And so I think that's a huge accomplishment tonight. And my background is marketing and communications. So my question is, how are we going to get that out tonight so every person in this district understands we've got plans? And I think one of the things that I've seen is we've talked a lot about email communication, and that's an equity issue for me because I know that not everybody gets our emails, reads our emails, or processes our emails. And so I guess what I would ask Leslie is what is the plan post this meeting that we get the really great information we got tonight from you, from Candace, from Jim, and from Shannon, that we make sure everybody understands that we've got a plan.
Mhm. Well, I think, and we've spoken about this a little bit before, and that's the role video plays and how people are much more likely to watch a 2-minute video than they are necessarily to read a 3-page email. Consequently, I think this can be much like Erica and I have already been planning a series of videos to answer some other frequently asked questions. I think we could make a very short video series, maybe 2-minute bites, that people could listen to get a lot of this information, because there's no way in the world someone's going to want to listen to a 4-hour board meeting.
Correct.
So dividing this up into something more consumable, I think, is the way to go.
And is that something that we can post on Facebook or give to other groups that they can post on their public or private so they get firsthand information from the district about what's accurate?
Yes.
Okay, great. So I think then we move to what is the timing and what is the risk tolerance associated with mental health versus physical safety and health, right? And so as we look at what we've been hearing about, people want 3 choices. Can you talk a little bit about, it all starts with social distancing, right?
Yeah.
And so why are 3 models not feasible from a social distancing piece or a resource piece that we really are looking at your online or your phase in which becomes an in-person? Why it's not feasible for us to have 3 models? And Jim talked about that a little bit, but I think that's another really important piece of information. So just wondering, Leslie, if you can answer that.
Yeah, I'm busy writing it down. Okay. Why can't we have 3? Well, we probably at the secondary level, I think the point I was trying to make when talking about the differences in teachers and licenses is that it isn't as easy as it is at the elementary school level to just say, here, these 4 teachers are going to teach the main subjects. Because first of all, they're really, other than freshman classes, there aren't main subjects. Kids are all over taking different specialized courses. And so the amount of choices that students have make it very difficult to create that little school within a school model, in addition to the teacher licensing piece. And then you add in the idea, people who just want to be all in all the time, that is creating that high risk environment that wouldn't allow us, gosh, we'd be quarantining kids all the time because there'd be no way to guarantee that they were 6 feet away from one another. So somebody gets sick, everybody that in the classes that kid was in will now have to quarantine. One sickness or one illness could lead to 90 kids in quarantine when we're doing something along that line. And that's not practical, and it's not going to lead to continuity of instruction whatsoever. So Jim wants to add to it. Go right ahead.
If we were to want 3 models, I think it could be done, but we would have to farm out the Oregon Online altogether.
Yeah.
And that there would be cost associated with it, and it wouldn't be Oregon staff. I think that would be something that we have not embraced as what we would consider to be service to our community.
And so I think a couple of important points with that is that we have a higher standard as Oregon education we deliver to our kids. And I think the other point is we can't look at this situation in a tunnel vision. It can't just be all about kids. We have to have the impact of, we know the number 1 determinant of a student's success is a teacher. And we have to look at what we're asking our teachers to do, how much. They can't work 120 hours a week. They are working on virtual. They're working on, if we go into in-person, then you've got a third in that. So for me, I would never support a 3 model program. It's just not feasible in terms of our resources. And so I think people that are thinking that we will be all kids in 5 days a week. Number one, it doesn't pass the safety test for me. It doesn't allow us to have social distancing. Number two, 3 models will tax our teachers incredibly and you all, and that's just not a feasible solution to me. I do have a couple questions associated with some of the things we saw tonight, and I know those are questions for people that are out there. If we're having hub models and we're bringing kids in, why can't we just start hybrid? Why can we bring some kids in and that's allowable, and why can't we just start our hybrid?
That's a good question. It's because we're talking about a very small number of students in one area supervised by one person, as opposed to trying to have in-person and online happening at the same time with half of our school. Because that right now would lead to significant issues related to infection and quarantining.
So again, the answer to that is it's not just kids, it's resources and safety. Right? Is that what I'm hearing?
Yes.
Okay.
Can
Want to add to that?
Yeah, just real anecdotal story, very quick. The more complex it gets, the more people that are in the building, the more moving parts. The school that I visited outside of Dane County, the day that I arrived, had quarantined all 10 of their English teachers the previous night, and they had 0 subs. And so it just shows how quickly the moving pieces in real time change the experience for everybody. So I think starting small is reasonable. Moving too quickly logistically is going to create a lot of challenges.
Again, I'm trying to ask questions that help answer people's questions, that make our point of there are reasons why we're doing what we're doing. And you are the experts in understanding that. Another point I think I would like to make is it's really, I don't want to say dangerous because that goes too far. It's very concerning to me when we attribute all of our students' mental health, anxiety, and stress to being virtual. I think Shannon pointed to that. We've been seeing suicide ideation and mental health and anxiety increasing exponentially for years. It's not all attributable to kids being virtual. There's a lot of things going on in this world right now, that COVID is one of them. Racial, social injustice, a really contentious political environment. Parents are stressed, kids are stressed. And I'm not saying COVID is not a big part of that, but to attribute everything to virtual learning is a really dangerous thing for me. And I don't know if you want to have any comment on that, Candace or Leslie. When did the school suddenly be responsible for every piece of a child's mental health because we're virtual or not?
Well, you're right about the fact that we've been seeing increased numbers for a long time, and that's why the school board made decisions it made to allocate significant resources to mental health over the past several years. If I remember correctly, it was something like $750,000 over a short period of time, because we've been able to track this as a significant issue for several years now. And that's why we've adjusted our programming and we've adjusted our resources to be able to meet the needs of the kids. Do I think the kids were already vulnerable? Does this situation make them more vulnerable? Yes. And that's why this isn't a time to pull back. That's why this is a time to push forward in as many ways as possible related to mental health supports. But this isn't new. And this isn't just because of our circumstances.
Right.
And I think we can gather that information that Shannon shared tonight, right? Like the comparison of last year to what we're seeing now. And when we get survey data for this year, for example, we can have a better comparison of what we had in the past. But we have all of those numbers that we've shared with you in the past. So we do have how many people we're seeing pretty consistently.
And then I think my other point is I just want to echo what I think Anna said. A survey is not a popularity vote. We have experts in position, and I think you've heard from the board tonight that we want kind of additional second opinions on in terms of metrics, but it's not a popularity vote what we do as a district. There's experts that are working to educate our kids, who are you. There are medical professionals and public health professionals that make those decisions. So I would really, again, marketing communications, and I know you'll do this, is it's not a question of how many people want to be in person, and that's going to make a decision for us as a board. I would not support that. We make decisions based on data and what we believe, based on mental and physical health. And this is really an important situation that we bear a lot of responsibility for, because as we hear from parents that they're concerned about their own kid, we are responsible for everybody's kid. And we're responsible for 600 adults. And there's mental health, there's insurance implications, there's resources implications, all those sorts of things. So we have more considerations than a parent about their child. And I'm not discounting that, because we know it's a really important thing, and I'm a mom, but we are charged with making that decision, and it's not going to be just based on who gets the most votes for what option. So I think those are my points. I really appreciate all the work that's gone in. You guys are taking some slings and arrows, and I think that in some senses that's a compliment, because people really care about what you've all delivered for their children over the last, careers of their education here. But Leslie, I know you're working weekends, you're working nights. Administrators, you're working weekends, you're working nights. Teachers, you're working weekends or you're working nights. And so everybody owes you a debt of gratitude, and we really appreciate that, and we see that, and we're here to support you. So lean on us. Thanks.
Thank you, Krista. Tim, I had a great day today. It was a crappy work day, kind of like Kevin. But I got an hour today at the middle school with my mentee for the first time since March. Kind of like you. Wasn't it a good feeling?
It's a good day. Yeah.
It was really good. And I missed her. And I think it was good that she missed me too, because of the disruption. We had a long 20-minute talk about COVID and the impact on her and her family. And there's a reason we have a mentor-mentee relationship with that. And I'm happy to report, Tim, that she's doing really well. And I was worried that I'd have the same sort of feedback that you had from your student, that there was a struggle, but she's actually doing really well, and her two siblings are doing pretty well too. So, it just goes to show the diversity in the district in terms of how people react to this. But it was a good day. It was nice to be back and to see her. And I think Krista talked about, let's talk about the thing we have in common. Everybody who spoke tonight, whether by written word or by the board or by the administration, has one goal, and that's to get back to what we used to be in terms of instruction. But we started on this path in late spring and chose a course that we were going to take, and that would be to entrust in our administration to work hard in areas of expertise in education, and to delve into mining the public health issues on that, and inform us and guide us through that, and let us be feedback people. And I don't see any reason to change from that, because our role is to oversee our administration in terms of how they guide this district. And if something's really off the rails, we need to talk about that. And I haven't seen that. The model that we chose and the particular path we chose was to go slow and to be patient through this, and not rush into opening up so that we would get interrupted in the middle of the stream of opening up. And I think we've heard that from a number of people, just don't go too fast, don't open up too much, because you might take 2 steps back. Well, that was our approach back spring, and we stayed true to that, okay? And so we're now at a point where, when Dane County said you had to all be virtual, we've now progressed so that we've got at least K2 in, and we started out very limited there, and now we're in at 4 hours. And what's concerning to me is that even with the limited in-school experience that we're having at K2, Dr. Bergstrom showed us the number of folks that have been impacted in the quarantine numbers that we've had just in that little bit of time where we've opened up, and if you grow that a little bit, that becomes concerning, and it takes us those 2 step back. So I think our approach right now is the appropriate one. Okay, to continue to be cautious, to continue to press forward, but at a slow, measured pace. And I know for Tim and for Kevin, that makes you anxious and you'd go faster. But I think tonight really helped in a large spot because, Kevin, I agree with you. We've got the where and the hows, kind of the plan is. And what I think we heard tonight is there's disagreement as to the when. Okay, and it was a really helpful discussion. I mean, we disagree, but hearing both sides of those, Chris was right. It shows people care, and the question is in the when and who do you trust and how do you go by that. I come from the beginning premise of Anna is if we've got designated experts in the field, I'd be hard pressed to deviate from them unless I see something wildly wrong with that. And right now, Dane County schools are following that. But, the question and right now, given the numbers in this state, I don't think it's time to start questioning public health. And in fact, from a non-scientific standpoint, when somebody tells me that public health's being too strict in Dane County and yet we have the lowest rates in the state, tells me something that maybe we're doing something right here in terms of where we go. Okay, and maybe it's good to be a little bit slower, but that being said, I understand the debate out there about herd immunity and starting to loosen up a little bit, and particularly now that we're 6 to 8 months learning about the disease entity. And so our program has always been dynamic and not static, okay? And while I'm not ready to say, Dane County mental health's wrong, I would like to see how flexible are they as we learn? Are they going to stay on their numbers? And if so, why? And what's the rationale for that? I mean, that's something I want to hear. And I know they've got a lot of background, the Harvard stuff that they modeled that off of. But as we learn more, are we going to stay at those numbers? And if so, why? That's something I'd be interested to learn about, Leslie. And also, I know you're in weekly contact with them through your communications. One of the questions I'd have for them is, okay, we've got plans now that we know what's going on and we know the risk out there and we know about preventions that we can take. Here's sort of our plans, okay, as a district, as a county. Here's kind of how we'd like to model this. If we do that, okay, are we going to still be at those same numbers? Is that hard and fast? Or is public health going to be dynamic a little bit on that? Okay, I'm not saying right or wrong. I just would be interested in the answer to that question, as we move forward, because I do come at it from where Anna is. I've been on the board a long time, and one thing I've learned is to trust those who you put in power to make those decisions for you, and I do that. But at the same time, it means asking questions. And the question I would have of public health is, are we going to stay at that level for a long time? Because that's a low number at the high school. And if they've got a good reason to stay at that level, I'm good with that. But that's an interesting question, I think, given all that we've learned about the disease and all the effort, in particularly our administrative team, in looking at what structure would work best when we bring kids back in. Does that change their dynamic in terms of what that spread's got to look like? Okay, that's my question, because it's all about the when now. We've got the how planned out on stuff, but in the meantime, while we're figuring that out, we need to do the survey. We need to get out there and continue to figure out what's working well and what's not, and what can we do better as we move through in sort of the slow growth mold and opening up sort of stuff. Okay, if that's helpful.
Thank you.
Yeah. Yeah. So I'm supportive of where we're at. I mean, if you want a bottom line, but you know me, I have some questions that I would ask public health on those issues. All right. Anybody on the board? I've talked to a couple of you over the last several weeks and about how we structure this, and it was much easier when we were in person, sitting around the table, that we could have more of a conversation, and trying to control from my end kind of an orderly progression of the meeting means I'm going to start with Troy and then I'm going here. But given that we've now had a circle around, anybody else want to chime in before we move to adjourn? Anything anybody wants to say? I want to make sure everybody has a chance.
Sorry,
Yeah.
Steve, I've got one more question. I'm sorry.
Okay, let's just raise your hand if you got something, then I
We
can
can go back. Let's go back the other way.
Okay, then I'm going to Troy.
I guess one other thing I forgot to ask, which is to Steve's point for public health, is, we had our K-5 plan, and then it was to K2, 3, 5. And so I know a lot of people are asking, and this is a good answer to have, is, what is the big difference between a second grader and a third grader? And if K2 is in and now the metric has not been met, but public health is still saying, oh, you can keep them in, why can't 3, 5 be in? So I think there's some, and I think other people mentioned, that's a little bit of a disconnect about, here's your metric, but K2's in, but the metric's not being met, but because you've started them, you can keep them in. And is that their mode of operation, is if you've started and you've met it? So I guess, if we're asking public health these questions, and maybe you already know that, Leslie, but that's, I think, a disconnect for people.
And I just want to make sure I know what question to ask. You're saying the disconnect is in why K2 but not 3, 5, right?
Well, what's the difference between a K2 and a 3, 5 student in terms of, so that I guess it's two questions. What's the big difference between if we have elementary buildings that are K5 or K6, what's the difference between a second grader and a third grader that makes them feel like it's okay to have a second grader in but not a third grader, is one question. The second question is, you have these metrics that you'd like us to follow. We met the K2 metric and we're in, but now the metric is not currently being met, but you say it's okay for K2 to be in. Why?
A couple of reasons related to K2 is what they're finding out is that right now there aren't outbreaks coming from the schools themselves with K2 in person.
Okay.
Consequently, they don't see the need to recommend closure of K2s at this point. So that part's really good, right?
Right.
Now for the 3, 5s, they chose to start with the youngest students because they were looking at research that said less transmissibility and less severity if they themselves are infected, the little ones. And they're the ones who struggle most with online learning. So all of those factors said, let's start from there. Otherwise, the idea of a phase in, I think, is predicated on the idea of smaller groups waiting, then another small group waiting, then another, so that it truly is a phase in situation, so that we see what the impact is there once we start adding in more grades. We're able to see the impact before we add in more. So it's really in line with what we discussed back in July before public health came out with any of this. And that is a slow phase in of grade bands.
Thank you. I just know people had that question and I forgot to ask. Thanks.
It's a good one.
Okay, raise your hand if you, Kevin.
Yeah, so one of the things I wanted to hit on that I didn't really spend much time on was pursuing, I know many of you have talked about it, many of us have talked about it, but pursuing, we'll call it a task force, call it what you want, and it doesn't necessarily have to model what Waunakee is doing. We have very talented people in our community, and I'm assuming you could pull together 8 to 10 people that are experts in the field that live right in Oregon. And I don't know who else we should be. I mean, obviously you got to listen to Dane County and and some of the other metrics, from different perspectives, but it sure would be great to do something like Wanakee did, and do that more formally. I think we should tap into the resources we have in the community.
Thank you.
Anybody else? Troy?
Yeah, just really quick, I guess I wanted to go back to Tim's statement about, feeling anxious with Dane County. And I agree. And I think Tim just put that comment really resonated with me. And I agree. I feel the same way. I think maybe where some of us differ is just in the timeline and our level of anxiety with what's going on around us, and it all goes back to that timeline and the comfort level. So that's all I wanted to add.
Anybody else raise their hand? Gotcha. I don't see anything. All right. Thanks everyone for really good discussion and conversation. Leslie and the administrative team, I know how much work went into that presentation, and the planning for it was terrific. Thank you for taking us the next step forward on that. So we're going to skip the summer school report and the report on professional development, and we'll move those into the agenda item for the 28th superintendent report. Real quick, Leslie, if anything that you want to add on?
Sure, I'll be very fast, but I wanted to do one really nice highlight, and that is this week we signed our continuing contract with Nehemiah Center for Urban Leadership Development, which will include multiple layers of professional development, training of our leadership teams to then go out and do professional development for their colleagues, as well as facilitation of a parent group and several community forums. So we're excited to take that next step with one of our partners. And in addition, Mr. Planner and I reached out to some of our old Madison contacts regarding potential facilitators / consultants to help us go through a process to develop the equity component of a strategic plan. So we made some really good connections of people who can provide some resources for us. And we feel like we might be onto something good there too. So we'll definitely talk about that more at the next vision meeting.
All right. Good, thank you. Future agenda, going to closing F. In 2 weeks, we adopt our final budget for the year, and we'll hear from Andy on that. And then we'll have the carryover of these two items from tonight. We'll probably have another update on the opening of school. I think we need a report on that. And where we're at, I think that should be a regular agenda item. So that's the future agenda. On Wednesday, we have expulsion hearing scheduled. Is there anybody not coming to that? Okay, so I've got all board members there. One of the things we may do is move for a half an hour the closed session item tonight. I think there's ways we can structure that so our time will be well spent and efficient on Wednesday night to move that. So Katie, I'll talk with you in the morning about redoing the agenda for Wednesday to add that, okay? So that we've got that done. All right. Checkout, I'll go through real quick. Krista, Heather, Kevin, Tim, Anna, Troy. After 4 hours, I think everybody got the message. That means somebody's got to make one motion. Thanks.
I'll move to adjourn.
Is there a second?
I'll second, Troy.
Okay, roll call, Katie.
Ms. Flanagan,
Yes.
Mr. Pankratz,
Yes.
Ms. Garrison,
Yes.
Mr. Waring,
Yes.
Ms. Bijak,
Yes.
Mr. LeBrun,
Yes.
Mr. Zach.
Yes, we're adjourned at 10:35. Thanks, everyone. Have a good night.
Thank you. Bye.
Aye.
Thank you.